school board meeting will begin in 1 minute. Please take your seats. Again, the school board meeting will begin in 1 minute.
Good morning. I now call the August 5th, 2021 administrative briefing and work session of the Marion County School Board to order at 9 a.m. Please silence your electronic devices and remove hats to avoid disturbing others. I now ask the school board attorney to explain the rules for this work session.
Thank you, Chair.
Good morning.
This work session is a public meeting as defined in Florida's Sunshine Law. The board is dedicated to full transparency in its meetings and its work. In compliance with the Sunshine Law, the board has adopted uniform meeting procedures, including the right for citizens to participate. The board will allow public comment regarding any work session item listed on today's agenda at the appropriate time. Speakers must fill out a request form and hand it to the school board secretary. After the board and superintendent have completed their discussion on a particular agenda item, the secretary will call speakers' names in the order received. At the podium, speakers are asked to state their full name and address and to spell their last names. Each speaker will have 3 minutes. As required by the Sunshine Law, the board must maintain orderly conduct and proper decorum throughout this meeting. Speakers may criticize subject matter and decisions in a respectful manner, but not people. Finally, speakers must be very careful not to violate the privacy rights of others, especially students and their family members, by mentioning their names or other identifying information. Thank you for your attention to these important rules.
Thank you, Mr. Powers. Okay, we will now begin our work session with the superintendent's administrative briefing. As we are well aware, we have our wonderful Ms. Teresa Boston-Ellis who will be filling in for Dr. Gullett today. But we do have Dr. Gullett online, so we can interchange like that. Good morning.
Thank you. Good morning, Vice Chair King, board members Campbell and Cummings, Attorney Powers, and Mrs. Prestipino. So glad to be here today and serve in a different sort of capacity, but thank you. The only item that we have for the administrative briefing is an update on the Howard Academy project, and if Mr. Robert Knight will come forward, he'll provide that information.
Thank you.
Okay, good morning, Mrs. King, Reverend Cummings, Mrs. Campbell, Mr. Powers, Mrs. Prestipino, and good morning, Ms. Boston-Ellis. Appreciate the opportunity, and good morning, Dr. Gullett, wherever you are. So, appreciate the opportunity to give you an update on Howard Academy. All of the bad wood that was underneath both bathrooms has been torn out. They're about 2/3 done the framing on the women's bathroom, and they've completed the underground plumbing. Now they can go in and finish the pier work underneath the women's bathroom and complete the framing. That'll happen next week. In the men's bathroom, they are in the floor decking stage. They've already completed all the repairs to the underground beams and joists that were damaged. The next step is to provide the underground plumbing. That'll happen next week in the men's bathroom. And after next week, they'll be able to finish framing the walls of both bathrooms, and then we get into the finishes and the plumbing that's in the walls, and we move into the fixtures. So it's still scheduled for completion September 15th. Next Tuesday, just to point out, I believe the board will have on the agenda a request to approve the exterior plumbing work. This is the rest of the plumbing for the whole campus, the sanitary sewer lines and the water lines, which are also in bad shape and will be replaced as part of this project, and that will run concurrent with the current project and finish at the same time. In the meantime, a temporary water line has been installed to feed the other two buildings so that they don't have a significant disruption in water. At some point, we will have to take the water service down for about a half a day to a day in order to make that change over to the new line and eliminate the temporary line. And that'll happen after school starts, but we're going to pick it either on a weekend or a time frame where there aren't any students or staff on that campus, so we don't have any sort of major interruptions that are going to affect the activities out there. So unless there's any questions, those are the highlights and the major updates for that project.
Or do you have any questions? Seeing none, okay.
I do have a question to the board. We did commission a committee to bring a report back about Howard Academy as far as what they wanted to see come back. I want to try and get that on the agenda for our next work session, if we're not booked.
For our works, I don't, Ms. Prestantino, do you have our calendar? You know what we can do while she's looking that up? We can revisit that. Is there any other questions, Ms. Campbell? We're good. Okay, thank you, Mr. Knight.
Thank you very much.
Thank you, Mr. Knight. September 15th.
Well,
Okay, is that it, Ms.
That's
Boston
well.
Ellis? We're good? Okay, thank you so
I think
much.
the next work session is the 12th?
The 12th?
Right.
I was going to let her pull it up, and that way we could see what,
August 12th work session is capital and other funds, 2 of 3, interagency updates, 5-year work plan, 2 of 2, and COVID-19 updates.
okay. Do you guys agree?
Yeah, that should be fine. And it would be good to have a plan in advance of it actually being ready.
So we're adding Howard Academy Committee.
Yes.
Thank you so
Thank you.
much. Okay.
That's all that I have.
Thank you so much. Okay, we are now going to move forward with our COVID-19 updates with Dr. Hembrook, Ms. Melissa Kynard, Mr. Chad Fraser, and Mr. McGowan. Good morning.
Good morning. Good morning, Vice Chair King, board members, Attorney Powers, Ms. Prestapino, and Ms. Boston Ellis, and Dr. Gullett. So we have a couple of updates to share with you. We wanted to first start with sharing with you, since the last work board session, what we've done and what ways we've communicated with principals and some of the processes that we're going to be following this school year. So since the last work board session, we've had conversations and principals were provided a lot of guidance about the last topics that we discussed at the work board session, right, regarding masks optional for students and those kinds of things. Since then, because we're giving them that autonomy, we've also had regular conversations to talk with them through what does that look like at each school, specific to that specific school site. We've been going through some problem solving as well. Ms. Kynard will actually probably elaborate on that in a little bit as well. And then we've reinforced what our mitigation strategies are at each particular school. We've emphasized, again, that cleaning enhancement that needs to occur. And we've talked about what happens down the road if there is, a particular area of the school that is getting quarantined or needs to be some extra cleaning. So we're communicating with our principals so that they fully understand that process and what to do in the event that happens. The other thing that we have talked to our school principals again is that we have implemented again that school COVID-19 liaison, so that at each school there is again a representative that the Department of Health will have that list of names so they know who to communicate with at the school. So that's the person that's going to be really well-versed and knowledgeable about what's happening at the school and receiving those faxes of any students that are quarantined and going through that reporting process. We've also been working with the Department of Health, as you know, and we've received an updated DOH reporting guidelines for them. So they've worked with us about a streamlined process so that the principals or school COVID liaison can communicate in a rapid manner to the Department of Health so they can start their contact tracing, right? So that we're identifying any students or staff that need to be quarantined pretty quickly. So that has already been shared with schools as well. We have also updated the COVID-19 portal that our school liaisons and school principals have access to. In there is all of our procedures and guidelines about what to do in the event someone presents with symptoms. It talks about students and staff. It's got the student letters that we share with families in the event that there's a quarantine. So all that site is all fully updated at this point, and the flow chart was revised as well. And then we will be starting COVID-19 tracking as we did last year. Andrea Simmons will be the lead on that, so you will be receiving a report. The report this year will actually come on Monday, though, and so it will be for that week prior. And so we'll be tracking those numbers for you as well.
All right, thank you, Dr. Hembrook. And to reiterate, as Dr. Hembrook mentioned, we've been communicating with our principals and our school-based leadership teams, and we did send out a COVID-19 survey with several questions on it, items like field trips, volunteers, our cafeterias, and using those larger communal spaces. I do want to let everyone know that the principals are certainly saying thank you for allowing our schools the autonomy to be able to plan for our students and taking care of our students as they know how to do with their teams. So they appreciated that autonomy to plan. As far as students being quarantined, when that happens on our campuses, the beauty of this year is that each school does have that homeschool liaison member that's able to have that direct contact from the teachers with our families and our students' families, ensuring that anything that they might need for missing instructional work, that they're able to continue. Certainly we want the instruction to continue as we may have students that are out on campuses for being quarantined. We do have, we'll continue last year as we did where, for instance, if a student is out for 10 days because they're quarantined, the teachers really treated that like they would do any absence, where they would make sure that they are getting the work to the students, right? And again, with that conduit being the homeschool liaison person, now we have that person that's able to help facilitate some of that. We do have Canvas as our LMS platform this year, our learning management system. Teachers have been trained on that. They're going through the trainings. Elementary, it's the basic overview of Canvas. So I would certainly be remiss if I stood up here and said that every teacher's Canvas page is absolutely ready to go, right? I would never do that. However, you know, anytime you're going through a new product, you're working through everything to make it how we want it. And so they're working with their school-based leaders. We have Canvas trainers that are teachers on each campus. They actually took more training this summer as the leads. They volunteered to do this for their campuses. So those Canvas leads have really taken on that focused role in helping the teachers on their campuses get their Canvas pages set up. So that they can continue to communicate with instruction if a student has to go out for quarantine during the school year. So that is certainly between communicating with the teachers, communicating through that homeschool liaison with the families as the students need to be out, and then making sure that we have Canvas ready to go moving forward that they will be able to rely on as well for looking for instruction there. And I know Dr. Hembrook is going to cover where we're at a little bit deeper in the instructional continuity plan, and she's going to kind of reiterate some of those procedures momentarily. Vacancies occur. When vacancies are occurring as far as staff vacancies, you'll remember last year that really the majority of the time the schools are able to rotate around their staff and really make it work when they have certain staff vacancies. However, they know that as they did last year, we're going to continue the best practice of reaching out. The principals will reach out to their area superintendent, us, and if they get to a point where they are not able to find a sub or they're not able to cover classrooms, that's when we have our list of district support and we push in to support those classrooms. So again, instruction is continuing on our campuses. That's something that we had started last year with our principals and will continue this year as well, moving into the new school year. Again, Dr. Hembrick mentioned those preventative measures. I just want to say and reiterate for the board and the public out there that our preventative measures also really rely heavily on just really making sure that we're encouraging our students and our staff that if they're not feeling well and they're showing symptoms and they're sick, that they're staying home. We can certainly, again, our principals will reach out to district as they need support on their campuses if they have staff staying home, but that's going to be one of our biggest preventative strategies and measures moving forward with over 40,000 students attending next week, is that if you're not feeling well and your student's not feeling well, your child, your own self as a staff member, you're being responsible and you're staying home when you don't feel well. That will help us not have to go back and do all the contact tracing for other students and other staff members that are coming in. In order to help facilitate all of this, right, we have encouraged and working in a partnership with Department of Health and Mark Landers, and we've been having weekly meetings for over a year now that you as board members have participated in as well. And then yesterday, I know Vice Chair King was on the call, and we really asked for going to twice a week meetings moving forward. So next week we start twice a week meetings with DOH, with our team, to really continue to monitor our numbers, to monitor the CDC regulations, DOH procedures moving forward. And that really, monitoring and having that conversation with Department of Health twice a week really goes into the next few topics that I want to talk about. Again, we, as part of that COVID-19 survey that we sent out to our principals, we asked them, because they know that we have said as a board and as a district that we're allowing volunteers back on campus this year. That's what we had said at this point. But we know that numbers have changed and some things have changed, right, with COVID. So we wanted to know what are their concerns, because they're the stakeholders. They're hearing from their teachers, they're hearing from their parents, their community, they're getting the phone calls, right, at the school level. And so honestly, with volunteers, we know that the volunteer process takes, just in a normal year, it takes the first 2 or 3 weeks in order to do the applications, in order to do the trainings, the background checks, everything that happens when you become a volunteer. And you do that each year. So we knew that that would take the 10 to 15, 2 to 3 school weeks before they would even be processed anyways. I think their ask, at least for the elementary side, and I believe for secondary as well, their ask is that we continue to have volunteers, because they want to have volunteers in their schools. They know the support they provide for their students and their staff, but they also are monitoring the numbers and seeing that as well. And so they really would like for us to continue to monitor the numbers. And then as we're processing volunteers, if things do change, that we continue to bring that information to them. So I would just ask us as you as the board and us as the district that we continue to monitor those numbers, and if any changes we feel need to be made, we would bring that back to our schools and administrators. And then as far as field trips go, we also asked them, what concerns do you see about having field trips? Because we've said, that we would allow field trips again. Some of their concerns are, even though we know field trips are optional, right? Parents can opt out. But then we know field trips, when you're taking the students off campus, the elementary principals had some concerns about that, because they feel like they can certainly manage in-house, right, in their own school, those mitigation strategies a lot easier, and safety protocols. It's not easy, but they feel like they can control that, and they've been working through that for the last year with their own personnel. When you take students on a bus and you travel and you go to a public setting, that becomes a little bit more difficult. You don't have the autonomy sometimes to establish those COVID protocols. You're kind of going into a setting that's already set there. So for our elementary principals, they have said that while they certainly want to do field trips this year, many of them are the ask is that they would hold off, for the first few weeks of school, maybe even the first month, continue to monitor the numbers. But I think their ask is that we wait on field trips. Again, that's not something we typically start out for week 1 or week 2 in elementary anyways. So it's really, honestly, not doing anything too different than what we would normally do in a normal year. Now, I know that's a little different for secondary, and that's why I prefaced elementary field trips. I know that Mr. Frazier has already been talking with a school that has an ROTC field trip that I think is the second week of school. Mm-hmm. So I know that secondary schools, at least for high schools, are wanting to continue to move forward with field trips. So I think really today we're asking for just maybe some feedback on if we're wanting to do different for elementary than secondary, or if we want to do a general, here's what we're going to do for everyone with field trips. But we told them, that we would certainly be getting back with them if we were going to adjust anything with our field trip current practices that we've kind of gone out with there. Okay, so that's kind of what I have. I don't know if you want to talk more about.
Sure. Thank you, Ms. Kennard. I appreciate that.
Mr. Frazier?
So, good morning, Chair Thrower, Vice Chair King, board members, Dr. Gullett, Ms. Boston-Ellis, Attorney Powers, and Ms. Prestipino. I did have an opportunity to meet with all secondary principals yesterday through a couple of different meetings through Zoom, and did request some feedback from them in regards to what their thoughts were. Obviously, what Dr. Hembrook and Ms. Kennard have already shared are applicable to all schools that we've gone through as far as right now goes. And we did talk about very specifically, the differences between elementary and secondary. So a lot of the secondary principals felt, as I was speaking to them, that they're in a little bit of a different boat than what elementary is, because if you're 12 and older, you are eligible for a vaccine. And with having a lot of the opportunities on school that are optional for parents to be able to participate in, all of our high school principals reported that they wanted to continue to offer athletics and also continue all off-campus activities for students as well. One in particular was the 5 junior ROTC members that have been communicating with the Tampa Bay organization and are scheduled to be their honor guard, the 5 students and 2 instructors, for their first opening home game. They've been communicating since early in the summer. The Bucks organization has required them to be fully vaccinated, the instructors to be fully vaccinated as well, and we'll be following all procedures that they put in place. That is happening in 2 weeks. And so our high school principals particularly have many things that are happening very rapidly as the school starts with athletics, and are requesting the opportunity for some flexibility to continue to offer those for their students. They obviously, with athletics as a whole, are familiar with capacity issues from the prior year and will be encouraging social distancing with all spectators that would come in. They would also be encouraging, masks would be optional, but we're encouraging to wear them as well. And in speaking with quite a few of our high school principals, they offered some pretty innovative strategies in regards to trying to offer vaccinations to a lot of our high school students and middle school students that are at the appropriate age. And very similarly to where we have offered blood drives on high school campuses before with parent consent, potentially offering some vaccination sites on some of our high schools with parent consent as well, to try to have as many students vaccinated and protected as quickly and as rapidly as we could. Some of our middle school principals, obviously, they don't start with their field trips and things of that off-campus activities quite as quickly as our high schools. And so as we continue to monitor the situation and continue to meet with the Department of Health to determine where we are, obviously we're going to have to continue to pivot as we have in prior years as well, to analyze the data, look at where we are, and potentially do everything we can to keep every single employee and every single student safe that are on our campuses as well.
Before you move on, you touched on field trips. What about volunteers at the high school level?
So a lot of our high school volunteers, it was real split down the middle, from middle and high school. A lot of our high school wanted the volunteers to still be on our campus, on their campuses, with the proper protocols in place to make sure that we are doing everything we can to prevent somebody who may be asymptomatic or may have symptoms coming on the campus. So we'd have to talk through that further with the Department of Health to see what their recommendations would be as far as that goes. A lot of our middle schools were shying away from having volunteers coming on. It was a pretty even split with half and half. Some really wanting to continue having those opportunities for volunteers on campuses, and some really cautious about having them come on as well.
And I know with the high school field trips, there's some industry certifications that do need field trips because they bring money into their programs with that. I'm just going to say how I feel about all of it. I think with elementary school, we do need to kind of put some reins on some things. Probably need to.
Mr. Cummings, can you speak a little louder because
I'm
the
sorry.
mask and it's harder to hear? Thank you.
Is it better, Kevin? Thank you. I think with elementary schools, we kind of need to listen to what the principals are saying. We do need to pull back, as you said. As far as field trips, they're not going on the field trips immediately. Right now, they need to be focusing on educational things. So I think we can pull back those things. As a board, I think we should pull them back. As far as volunteers, I think we kind of need to mandate some things with volunteers across the board, and it needs to be consistent. If they're coming on our campus, we can't control what people do outside the campus, but if we want volunteers and they want to come and volunteer on our campus, I think we need to require a mask. I personally think we need to require a mask and keep our people safe, keep our kids safe. I didn't hear, and I guess I didn't hear, as far as the quarantining, did anything change about the number of days as far as a person that's quarantined that's been vaccinated or unvaccinated? Did the numbers change? It's the same thing. It's the same number. Was it 10 days? According to CDC. So nothing's changed with that. And then I heard Ms. Kleiner and I heard Dr. Hembrook both say CDC recommendations. We prided ourselves last year on following CDC recommendations. And I seem that we're moving away from CDC recommendations. And if we're going to move away from them, then we don't need to mention CDC recommendations. But if we're going to mention CDC recommendations, then we need to follow them to the hill. Just a couple of days ago, I got information. Well, last night, we were at a 24.5% positivity rate in Marion County. 24.5%. That's 5 times more than that it's supposed to be if we were going to start removing mitigating practices. So I'm kind of puzzled why we're in a rush to move things out when the numbers doesn't support us moving things out, even with our students and our staff. So that's Cummings.
Ms. Campbell?
My first comment about the field trips is, while I understand that some of the elementary principals may have concern about wanting the board to make the decision for them, I feel as if we've heard 2 different things from them. They appreciate the autonomy, but yet they want us to make a decision for them. And so in my mind's eye, frankly, if we continue to give them the autonomy, then the volunteers on their campuses that they would have to welcome to their campus, somebody's not just going to show up. I mean, they would have to open that door to allow those volunteers on their campuses, as well as field trips, that they would have to ensure that they were sending out the information to parents and all that goes into planning those kinds of things. In my opinion, I'm fine with the autonomy across the board. Similarly to the way Reverend Cummings stated about us having the same policy secondary and elementary level, I do think that, in my opinion, that we should have the same policy across the board, and we should allow those principals and those leaders that have been put in place to do that the autonomy to make those decisions for their campuses and their communities.
I think we're a mixed bag here.
And there are only 3 of us. So
And there's only 3 of us today. I think what I heard was loud and clear today is that the elementary schools feel right now that what's working best for them right now is to hold back on the field trips and no volunteers. I wouldn't be opposed to, our numbers, as you just stated, they're climbing and they're higher every day. And if you pay attention to the numbers, the average age right now that is grown is between 25 and 54, and that tells me that's probably majority of our volunteers. So when I look at the numbers, I'm seeing the highest growing number coming into our schools. And I personally, maybe the first quarter, maybe halt the volunteers, because we did learn a lot of things last year. And one of the things, and it's painful, and volunteers are so important, but we were very strict on who we allowed into our schools and how that worked. And I take a lot of pride in that we did not close one school last year. So I personally would like to see the volunteers, at least for the first quarter, until our numbers can go down, just try to mitigate that if we can.
Elementary or?
Well, and this is where it gets tricky, because with the high school level, Mr. Fraser, you made a very good point. Like, those are the ages that, they could have vaccines. And so it's kind of a different, so I can see both sides of everything. And I probably would like to see the autonomy, like, in the high school level with that, because I don't want to just take everything away from them. And it's just different, in my opinion. But if we think we should be doing it all even, sometimes it's not always fair for all,
I think for the high school, secondary, they need certain things. They're trying to graduate, trying to get scholarships,
Yeah.
all those types of things. And they are at that age where they are above 12. And if their parents have wanted them to, they could have gotten that vaccination. I could go for that. But definitely elementary, I think we definitely need to pull back. Because we're hearing the elementary principals say it. And I get what Ms. Campbell is saying about giving them autonomy, but
They're wanting us to make the decision for them.
well, they're wanting guidance, and I think that's
Right.
what we're supposed to be giving is guidance to them so that they can make sure that they're doing their job effectively. If you got one school over here doing one thing and one school doing another thing, I think that just creates confusion for the community, because you're going to get the calls, I'm going to get the calls, you're going to get the calls. Why is such and such school over here? Then there's, if we're consistent across the board with some, you can't have 10 different rules for two kids, and they can't have different rules. They have to have the same rules, or the house is going to be in chaos. And I think that's what would happen if we just gave all of them that autonomous leeway. So that's me. And I definitely think those volunteers that are coming on campus, and this is the elephant in the room. I believe they need to have on masks. I really do. They're coming onto our campuses. They need to be masked up. They need to follow every precaution on our campus. And we made some decisions a couple of weeks ago based on numbers, based on positivity rates, based on what our county was doing at that time. Since that time, things have changed. Things have really, really changed. And we have to be smart. We were put on this board to make tough decisions and decisions about the safety of everyone, what's going to be good for everyone, our students, our staff, everyone. And I think parents need the option of opting out. I like what I've been seeing in some other districts, letting them opt out of the mask. But I think we need that as a district. We need to govern, because that's what we're supposed to be doing, governing. And we can't keep just sliding based on what other people are saying. We need to do what's right. If parents want to opt out of their kids wearing a mask, let them opt out. Let them sign the paper, say they don't want their kid to wear the mask. But we need to have things in place as a district. And that's unpopular, but I'm not here for popularity. I'm here about doing what's right, what's safe for our kids.
And when it comes to quarantining, so if a student is wearing a mask, the quarantining protocol still stays the same, correct? That even if you have a mask on, if you are a close contact, then you are still having to be quarantined, masked or not. Okay.
Same. And I think we've talked about what's most important. One of the things that we said that's most important, we just got school grades. One thing that's going to be most important is keeping these kids in the classroom.
Absolutely.
In front of folk. So we need to do whatever we can to mitigate that and keep them focused in the classroom. We don't have the NCPS online this year. We've gotten things taken away from us. So as a board, as a community, we have to do what we need to do. We can't just keep kicking the can down the road saying, oh, the grades aren't as great as they should be because of COVID. Every year it's going to be something different, something different, something different. Let's do what we need to do. Take care of folk, give them what they need to do their jobs, and get our kids educated. Point blank, point blank.
So your recommendation would be that rather than giving parents and families the optional opportunity to have their students in masks, it would be, their option would be to opt them out of having them.
Let them make the decision.
So, I mean,
not us make the decision.
And-
We said optional.
But, okay.
We need to mandate the mask and let them opt out.
Well, when I hear that, I see a lot of work, right? So we're going to be putting where they have to opt out. So basically, the way it is right now is they can opt in, right? So everyone has a choice. So this is what my thoughts are. And I even heard Mr. Landers say this yesterday. The most important thing that every person, whether it be your student, whether it be you, you're an employee, whatever it is, consult with your doctor and make the best decision that is right for you, okay? So I completely understand what you're saying, Mr. Cummings, because I make my choices too. So I just, when I think about opting in, I just see work, and our teachers and our employees need to focus on their work. That's just kind of optics to me a little bit, but I completely understand what you're saying. So I'm comfortable leaving it as is right now, but I will stress the importance of everyone to consult with your physician and do what's best for you. So I don't know.
So when we, how hard is it for, we give all these papers, get permission slip, my child opts out at the beginning of the school year? How hard is that?
That's not the hard part, but enforcing it is the hard part.
I think it takes it takes the responsibility off of us. We as a district have said everybody can opt out. When the parents, we're talking about responsibility. We say everybody's responsible, everybody should be responsible enough to do the right thing. Well, obviously, people aren't responsible enough to do the right thing, because if they were, our numbers wouldn't be where they are right now. So I can't assume that everyone is going to be as responsible as I am.
Right.
I can't assume everyone is going to be as responsible as you. So when we kind of put things in place to say, okay, Mom, Dad, it's your right to send your kid to school without a mask, put them on the bus without a mask. Because I just see things, I see down the road, somebody's going to come back and say, hey, you guys allowed us to be on the bus with no mask. You allowed us. No, I'd rather for that you allowed your child, not that we allowed them. I mean, I hope I'm making sense.
I understand. I see your points. I most certainly do.
But I'm good with whatever we do, but I just want to make it be known that everybody is not responsible.
You're absolutely correct.
I was at several things last week, and I stood up and specifically said, if you are sick, please don't come to work. Please don't show up. And they were in the crowd at that moment, and you endanger your coworkers. You endanger other people, and that's why the tracking is so important. I'm just going to be honest. I'm not confident in this contact tracing. I'm not. I'm just not confident that we're getting all the contact tracing. So I don't want us to just throw everything out the window and say, okay, we good, because we're not good. We're not good locally. We're not good statewide. We're not good nationwide. So I don't want us to just throw everything out the window and just be willy-nilly and free on everything, and knowing that the goal is to keep these folk in the classroom, keep folk on the job. That's the issue.
I hear you, Ms. Campbell.
And I completely hear everything you're saying, and I completely understand the position. My comment is the only thing of the mitigation strategies from last year that potentially is changing is that face coverings are optional. Everything else from our mitigation strategies from last year all of those strategies are still in place to the best of our ability, as well as we did not see when we had optional face coverings at Camp Kiwanis for 4 weeks, in our summer school with 7,000 students in our summer schools. We did not see classroom spread to what potentially could have occurred. Additionally, last year in January, when our numbers weren't quite what they are right now, but they were pretty close, we still did not have the kind of spread in the classrooms, excuse me, the kind of spread in the classrooms that the community is seeing. And so what I want the community to understand is, certainly as we see how school starts, and if something drastic occurs, or we're going to be monitoring weekly and talking to the Department of Health twice a week, and we're going to be tracking this extensively just like we were last year. I see, as what Ms. King is saying as well, the challenge of having parents opt out of their students wearing face coverings is a paperwork nightmare, number one. It puts all of the responsibility back on a teacher to be a mask police officer, because then they're going to have to track who has signed it and who hasn't. And similarly to a photo release, which we don't have quite nearly as many of those, but if you've ever walked into a classroom and you have a teacher knowing which child can't be photographed, and that's fine. It's a parent's opportunity to do that and to make those decisions for their children. However, this is on such a grander scale on an everyday basis. You don't always have someone walking into your classroom to take a picture, but this would be every single day, every single opportunity, and making sure that only those children whose parents have opted out for them. It just, at this point, we've all made a decision, that all of us sitting here, we all made a decision today that we wanted to optionally put face coverings on. There are additional people in the audience that made that decision, that they did not want to wear face coverings today. And we're all doing fine. So I would like to see us to continue that process, and rather than having families have to opt out, allow them to continue to opt in, just like we have for the last 3 to 4 months of everything we've done with Marion County Public Schools.
You said something. You said if something drastic occurs.
In a classroom, that would be in school setting.
Something drastic is happening now.
Yes, Reverend Cummings, something drastic
So
is occurring in our community.
What is the cutoff for something drastic?
Sir, it's going to be based on
Because we said
in
CDC says below 5%. CDC says below 5%. We're at 24.5. That's 5 times higher. That is drastic.
But that is community. That is not classroom. That is not in
Is the
schools.
classroom in the community?
Sir, whenever we had this happen last year, and our numbers were pretty significant in January, we did not have classroom issues like what.
Does the classroom come out of the community?
Yes, it does.
So it's a community.
However, whenever our community was also in a crisis, the first crisis we had seen, we did not see the issues in our schools because of our mitigation practices. The only thing that will be changing is the fact that parents have the opportunity to choose if their child would be in a face covering. That's it.
You said because of our mitigation practices. We're loosening our mitigation practices.
Vaccines were also not available in January.
We're still loosening our mitigation practices. I mean, I'm not arguing. I'm not fussing. I'm just going to state what it is, and we're going to do what we're going to do. But it will be on the record, my position about this.
Yes, sir.
Because this is serious.
Most certainly.
Definitely serious.
It is most certainly serious, and I hear your valid concerns. What I believe I am hearing from the board today is that masks are going to continue to be optional. But it will be noted, Mr. Cummings'
Thank you.
thoughts and his opinions. I have also, correct me if I'm wrong, I've heard that for elementary school, there will be no volunteers and no field trips for the first quarter. We will come back and revisit that. I have also heard with high school, with the volunteer, high school, middle school and high school, volunteers are,
We gave the autonomy to.
we are given the autonomy. to the schools.
As well as field trips, I think.
Ms. Kynard?
Sorry. So I love the robust discussion. That's great. What I would like to go back to just momentarily is that I know, Vice Chair King, you had put a time frame when you talked about volunteers and waiting till the end of the first quarter. I just want to remind everyone that that would be mid-October. When I reviewed the comments, yes, the elementary principals are concerned about starting right away with volunteers, but they also knew that it would take 2 to 3 weeks to have a volunteer on their campus, irregardless, because that is our process for background checks, for all the paperwork. I know that I have personally had principals reach out to me the last couple of weeks. We have our Good News Club, which we really were not able to have last year. We have a lot of those Good News Clubs in our elementary schools. That is an afternoon club after school hours. Parents do have to give permission for that. Technically, Good News Club members that come onto the campus, they do all of the volunteer protocols that we have in place for any volunteer. So I just want to make sure that we're all clear on when we say the first 9 weeks, because we want to make sure we're giving the correct message to all of our principals, whether or not we would be able to have that. That's something that the parents obviously would get permission for their student to attend or not attend. And in addition, we also are creating that district opt-out letter, so that if a principal did decide to have volunteers, let's say in September, the parents would be able to still opt out of not having their child work with a particular volunteer if they knew one was going to be in the classroom. So we do have that we're going to do as well. Just wanted to make sure that we were putting all of that out there for the conversation.
So are we saying like not do a whole quarter, but maybe 4 weeks?
That's
4.5 weeks?
right, because
Labor
we've upped our DOH calls to twice a week. And so we know that we're monitoring the numbers every day, but twice a week with Department of Health. And so to take that all the way to mid-October, I don't know if that's, because things change, right? Things have changed in the last 3 weeks.
So can we revisit it then in 4 weeks?
After Labor Day, maybe?
I think we have board weekly, we have work sessions
We
weekly
do.
coming up in August.
We
So
do.
we can, I think doing 4
we can
weeks would be good,
continue.
because I think we're going to be up here.
Yeah, I just think it needs to be clear, as long as our numbers are climbing and high, we're not gonna just all of a sudden open it up, so.
That's they asked that we just continue to monitor and readdress this.
And they are supposed to be wearing masks, the volunteers. Did I hear you say something like that?
So we would seek your guidance on that. We have not, that again, according to what we've done so far, would be optional, but I heard you, Reverend Cummings, say that. I will say that there were some principals in the survey that did make the comment that they would feel more comfortable with having volunteers on their campus if we could ask them to wear the face coverings or even fill out the COVID questionnaire that we would have sometimes last year with the volunteers. Not volunteers, but the visitors.
I would be
So
in
that-
favor that they wear masks. Recommendation. They're coming onto our campus.
I would be fully in favor of the questionnaire to continue for sure. Any visitor coming onto campus, I think the questionnaire still definitely needs to be in place. I'm still of the mindset that optional face coverings, just as, like I said, half of us in this room have done today.
It only takes one irresponsible person to mess up this whole room. Only one.
Madam Chair, I would like to seek also guidance from the board, because these are probably questions that I'm going to get later. Regarding if volunteers are required to wear masks while on campus, because of one person could potentially initiate spread. We also have vendors who are on campus. We have delivery personnel who are on campus on a day-to-day basis in far greater quantities than volunteers. And so we would probably need to know whether any of this is supposed to apply to them. And that may be something the board wishes to defer and address at another time, and specifically only deal with whether volunteers, because they would have close contact with students, that may be the deciding factor. But that may be something that we need to address. But secondly, when it comes to volunteers, masks or not, if we're limiting within the first few weeks of campus, I've been involved in a bus buddies training with
Ms. Thrower. It's a pilot program that's specifically intended to help familiarize students with and help them overcome difficulties with bus routes and things like that. Now, there's only a handful of volunteers, but it's specifically targeted as a pilot program with a handful of volunteers within the first few weeks, because that's when those kids are coming up to speed on learning about bus routes and getting adapted to that for young students. And I believe there was only 2 or 3 schools that were doing it with. And so most likely, I think I'd be remiss if I didn't mention, because of Ms. Thrower here, she probably would want to bring up how that would impact that specific program, given that it's intended to be a beginning of the year program, perhaps not a long-term program. So just some things I'd probably seek guidance from the board on regarding those particular issues, because it's likely going to need to be something I need to get back to the board on with any questions that arise.
I'm still comfortable waiting a month while our numbers are climbing to not allow volunteers on, if that's what we're hearing, then that's what we're doing. I mean, maybe in a month they can start that program then.
Understood.
Do you guys agree, or?
I agree.
Okay. And is mask, I even think with the state level, like mask, I think are pretty much, I don't need, I just think we're getting in a, I hear what you're saying, and I think it's responsible for those people to wear their mask if they come in, but.
Can I see clarification on the board consensus? That is to limit or not have any volunteers for the first 4 weeks, elementary only?
There will not be volunteers for the first month for elementary.
That includes the bus buddies, correct?
And that includes, but unfortunately, that includes the bus buddies.
Okay, thank you.
I disagree with that, but consensus is to go with it.
Okay.
Powers, can you advise if that's a consensus or not a consensus?
That is 2 members of a 4-member current panel, so it's consensus of the quorum that we have present, but
Right, I was going to say, well, we have a quorum now. When our chair comes,
it can
see
be
what
readdressed
happens.
if need be, right?
Thank you.
Okay. Mr. Frazier?
Vice Chair King, I would just like to thank the board on behalf of secondary school principals for giving the autonomy and still allowing students to be able to, especially particularly high school students, still being able to participate in the programs that will help them either be ready for a career, potentially enlistment, or potentially for a college path. So thank you very much.
Thank you. I do have a question. So you said that we're going to be going back to tracking in the schools, each schools. Our data is coming from what we know, correct? Not necessarily from what we're getting from DOH.
Correct. So the way that it worked last time was that when the schools had student or staff members that were quarantined, and the DOH did the contact tracing in collaboration with the schools, then those numbers were reported as to the number of positivities and the number of quarantines. My understanding is that will be the same process that we're going to use this coming year.
So DOH is going to do the contact tracing.
So they do it in collaboration with, yes, they do it in collaboration with the schools. So if let's say a student is identified that they or positive, then they go back to the seating charts of where that child was throughout the day, and the principal or the COVID liaison works with the Department of Health and says these students were in proximity of this particular feet away, and they work with the DOH to say which of those students would need to be quarantined.
So my question would be, how soon is that supposed to take place? And that's probably not your question. It's probably a DOH question. And the reason being because there were many occasions where we had positives in the classroom last year, and the contact tracing was not done as rapidly. And I got the call. I reached out to the superintendent, and we had to end up doing our own contact tracing. And here it is, 5 or 6 days had already passed by. That's serious. That's serious. So can we get a number on how soon that contact tracing is going to be done? As soon as, and I think, and I'm saying this, I think in conjunction, I know, and guys, listen, please don't think I don't understand what we're facing. We're challenged with staff, and I get that. I think we have to be more diligent than others because we're talking about our people, our students. And I don't know how overwhelmed the Department of Health is right now, but I believe they are overwhelmed. Like I said, I got communication last night that they're tired, they're exhausted. And when people are tired and exhausted, things slip through the cracks. And we can't afford for our kids or our staff members to be slips. We can't afford that because, again, priority, keeping them in the classroom, keeping them in front of the teachers, keep the teachers in front of them. So I'm hoping that, I guess what I'm asking is that our schools kind of already have a plan for contact tracing, their own contact tracing, and saying, okay, if they're within that 6 feet or 3 feet or whatever it is now, is changed, that we start making our own decisions on that.
Yes, so yes, great question, thank you. And you're right, there are some challenges in staffing, but through our collaboration and relationship with the Department of Health, we've identified some of those challenges, and we've implemented some great conversations and systems to help that process go faster. So yes, our principals are very well versed in what student is more likely to be quarantined, and so they do go ahead and pull that student if necessary. The other thing that I had mentioned earlier is that DOH reporting process. So as the year went on last year, we realized that there was a challenge in the timeliness of contact tracing because they're working really hard right at the Department of Health. The updated protocol includes several different methods of communication from the school COVID liaison. So if the phone calls doesn't get answered, there's multiple people on that reporting form that the school COVID liaison can contact, and email accounts as well. And that did help last year to speed up some of that process. But yes, to answer your question, our principals do know what to do in those cases.
I just don't want it to be 5, 6 days and kids are sitting in the classroom, they've been exposed 5, 6 days. Now they have it. So, and the thing with this variant, with this Delta variant, it's as contagious as chickenpox, which from my understanding is 9 times more contagious than just a regular COVID variant. And I got that from a health professional last night. So we can't just afford to let them sit there in the classroom that way. Staff, teachers, kids, whomever, we just can't afford to let them sit in the classroom that long.
So Board Member Cummings, I'd like to speak to that as well. I had the opportunity to serve as a sitting principal last year at a secondary school and did do consistent contact tracing. And I can speak on behalf of all secondary principals in Marion County that their first and foremost priority is to keep students in the classroom. And unfortunately, there are variables, as we all know, when we start dealing with circumstances with contact tracing. And a lot of times, from my personal experience as a school principal, variables would come into play where we were not contacted at the school level that a student was positive. And so that was what I experienced in delays of not being able to contact trace as quickly as what we would like to, just because we were unaware of the situation. But I can rest assure you that our Marion County principals will be on top of it the second they are notified.
Thank you. Thanks.
Do you have anything else you need from us?
Yes, I wanted to, thank you. I wanted to give you an update on the instructional continuity plan. So this is the instructional continuity plan that's due to the State Department on September the 30th. This is to identify what is our process for students that are quarantined. How are we going to continue that instruction? So there was a state webinar on July the 22nd, and the team that's on the Instructional Continuity Plan, or ICP, so they attended the webinar, and they received a few more specifics. There's additional training still coming. I think it's around the week of the 23rd or 27th of August, somewhere right around there, and our team will attend that as well. But so far, what our plan has been a little bit revised based on what we already heard, so I wanted to give you a little bit more details. So as I mentioned last time, elementary teachers will post their assignments in Microsoft Teams. And additionally, we're going to create a resource packet for parents. And this resource packet is really some online tools, and it will have links to videos about how to access Microsoft Teams or how to access the textbook online electronically. The teachers also, through our Savis textbook and our Go Math textbook, there's actually videos that align to the standards for that week. So teachers can very easily, when a student is out on quarantine, they can, with a few simple clicks of a button, assign videos to that particular student. So when the student is at home working through some of those assignments, the parents can pull up that video for the student, and that's just another resource for them during instruction as well. So we can do that for English, language arts, and math. Our social studies and science at the elementary level is actually already electronic. It's STEM Scopes and Studies Weekly. And so again, those will be accessible through Microsoft Teams. The resource packet will have also a QR code that parents can scan in, and that QR code will take them to some simple videos for troubleshooting or, again, how to access some of those resources. And so that's at the elementary level. The secondary level, it's more course specific because their courses are credit earned and very content specific. So those teachers will continue to post their assignments through Canvas, through the LMS. We are actually going to create a resource packet for secondary as well. It will be a more simplified version for secondary, again with that QR code about how to access their digital resources as well. For students that need the Chromebook or a hotspot at the time of quarantine, we are going to be ready to issue those at a moment's notice, so that the minute they're quarantined, here's your devices that you're going to need. We are prepared. We're going to have to do this as a case-by-case basis. We know that not all areas in Marion County have the best Wi-Fi capabilities. We can change out some hot spots, though, to try to find the right one for that area. If we continue to struggle, then we're just going to have to provide, with the homeschool liaison as well, some specific resources for that student to continue instruction in the best way that we can. A lot of that will happen case by case. And then the homeschool liaison is going to really play a pivotal role in this. They're going to make sure that as students are quarantined, the homeschool liaison is going to be trained to reach out to those parents right away, make sure that they have their Chromebook and their hotspot, make sure that they have the packet, make sure that they know where to look for the assignments, and then also to provide services if they need counseling services, right, or food services. Our homeschool liaisons are going to be trained in how to help the families with those particular services. And that's the update at this time. After the next training, I will be happy to bring back to the next work session some additional details.
So those homeschool liaisons, they're going to be the integral part of that part of it.
Yes.
So
Yes,
have
sir.
they been trained on what to do? Because I don't want them to get in the field and then there'll be like a learning curve. They're trying to learn and teach someone at the same time. That's like the blind leading the blind. So have we done what we need to do with them to make sure that they're up to par? Right.
So as the instructional continuity plan is developed and approved by the state, we're working through this timeline right now. They already have some trainings on their calendars. I think the first one is, I think September, I'm not sure. But we're going to be definitely training them on how to access some of these resources.
Dr. Reese, our director in federal programs, is kind of owning those homeschool liaisons, the trainings, because she has homeschool liaisons through federal programs department that are already trained on her staff, and so they'll be able to assist in that training at the school level as well.
I just wish we called them school-to-home liaisons. That would make a lot more sense, because as it stands right now, it sounds like that all of our students who are being homeschooled in the community that might be going through Marion virtual programs or something so school-to-home liaisons just works better for me, but I know that that's their title, so it is what it is.
It is because that was the existing
Right,
job description.
job description.
I know we mentioned that last work session, and we've spoken to Ms. Talbert Irving and Mr. Green about looking at revising their job description. So that's something that we can certainly bring to the board and maybe even have a different, more appropriate title.
Thank you. Is there any more conversation from the board before we move on? We good? Okay, I did sit on the DOH meeting yesterday, and I just want to assure everybody that there is good communication between the DOH and the school board right now. Mark Landers did mention, he's like, okay, we'll go to 2 days a week. If the numbers change or there is any need, he even mentioned 3 days a week. So please be assured that we are working very closely with them, and we will be tracking those numbers too. So just wanted to reiterate that also for Dr. Gullett. Okay, thank you. Is there any public comment? Or wait, Mr. McGowan? You were sitting in the back, so I just
okay.
kind of overlooked you.
I will be brief. As part of this conversation, as Reverend Cummings alluded to, one of the important factors in this conversation is making sure that we have students enrolled in front of our classroom teachers. And so I wanted to provide a brief update on LexisNexis, which was a database that was purchased by the district last year to help locate as the state defines unaccounted for students. So as a total, just to kind of give you some numbers from last school year, in terms of how we identified students as D&E or did not enter, we had 387 students identified with that code. Through the work of our school staff and our social work staff, all were located except for 79 of those students by the end of the year. So LexisNexis is a database that did help with that process. Basically, it's a database or search engine that utilizes many other databases and uses personal information such as name, date of birth, phone numbers to locate individuals, and past phone numbers, past home addresses, so that then we can follow up. What we learned through using that database is that our social work staff is really good, and their boots on the ground work with home visits and phone calls. They utilize a lot of the other databases that LexisNexis uses itself. But LexisNexis, in and of itself using it, there were 59 searches conducted by our staff. And I want to pause there just to mention, we only gave access to 2 individuals. It's a per user license that we pay for. And because of the sensitive nature of the information we're entering in, we had 2 individuals have access to that. So there were 59 searches conducted, and of the 59, only 22 gave us new information, contact information that we didn't already have. And then, of course, our team followed up with those 22. So just wanted to kind of provide that, that information. For the cost, I think it's relatively cost effective to have it as a tool. It is a useful tool, but it's not certainly the end-all be-all in helping us locate those unaccounted students. But again, through our work of our social workers, especially our social work assistants, they're the ones that are really in charge of our attendance, working with schools, and I think they'll work very closely with our homeschool liaisons. I actually have a meeting with Dr. Reese later this afternoon so that we can coordinate those services. Our social work assistants can work with homeschool liaisons, because homeschool liaisons will be at the school on a daily basis, where our social work assistants are not. So moving forward, and I'll kind of wrap up with this, one of, I think, the concerns last year that we had about trying to find unaccounted for students is, what's our criteria for an unaccounted for student? So I think our team did the best we can with kind of information we had. But what we've received from DOE through one of the ESSER II grant narratives that we have to provide for them is they've provided definitions of what an unaccounted for student is. So using that information with Philip Leopard and with Vicki Vaughn's team, we've identified per those definitions. So we have 173 students identified right now that once school starts are deemed as unaccounted for by the state. So once school begins, we will see who's enrolled and then follow up with those students that are not. So that's kind of where we are at moving forward. But again, just wanted to provide you that brief update on LexisNexis, because I knew that was a new addition to kind of our, the tools we have available to us.
So, I'm sorry, Mr. McGowan, you mentioned that there were 79 students that we still were unable to locate in any capacity. I have concerns about that, but I also want to ask, are those 79 also included in the new 173 number?
I would have to do more research on that. I know the information that was provided to me was by school level, how many per school, so I don't have the individual student's name. I'm not sure exactly the status of the 79 in terms of the brief information that I received was basically that when they were trying to locate those students, they could not be located, whether any past address, they certainly weren't enrolled in the district or in a homeschool program, they weren't able to be contacted. So they could have moved out of district, out of state.
And the LexisNexis software doesn't necessarily connect if they've enrolled in another state or?
Not to my knowledge. And to be honest, I think that would, what would kind of help us at the state level is if we were able to see, because obviously if a student leaves our district with a proper withdrawal code, we can tell if they went to another district or out of state or out of country. But if it's not a proper withdrawal code, if they just don't show, then we don't have any way to track to see if they've enrolled in another district, when they very well may have. And they could be enrolled in school in another district, but we wouldn't have knowledge of that.
So there currently isn't a statewide system that all talks to each other?
Not to my knowledge.
Or nationwide.
So,
Ms. Conard?
so I just wanted to add that as students do move and enroll in another state, the school typically will call the last school, as long as the parent is saying, this is where I was at, Wyoming Park Elementary in Ocala, Florida. And then they request the records from that school, and so then our IPCs do put that appropriate code as to where they've gone, and the withdrawal code becomes effective then when they hear back from the other school.
So could it be that some of these kids that we haven't found did not traditionally enter into a regular school, but are possibly being homeschooled?
So absolutely, and I will say, as we've been on campuses the last week and a half more rapidly, parents are coming in droves, registering their students. What I'm hearing from IPCs and principals is that many of our students that are coming in and they're registering, they were, let's say, the parents are saying homeschooled last year, but they were at home, not officially registered through our homeschool department, but they were at home learning. So I think a lot of those numbers we'll be able to find in the first 5 to 10 days at our schools. That's something that we'll work closely with Mr. McGowan's department on, with our social workers and social worker assistants. The homeschool liaisons, again, will be vital as our students start entering onto our campuses. And then those DNE students that do not enter in the first few days, we will be all over, again, trying to locate those students and where they're at.
So you said something, Ms. McGowan. You mentioned about the social worker assistants and the homeschool liaison. Are they doing the same thing with their job titles? Are they?
No, they're two different roles. So really the role of the social work assistant is attendance and attendance tracking and home visits, and then the follow-up child study team meetings for non-attendance if they're not meeting our attendance requirements. Certainly I think some of that the homeschool liaisons would assist with, but I think kind of as we've heard, their role will be more for those students that are quarantined, making sure that they have, so I wouldn't, some of it certainly overlaps, but certainly not the same role.
Any more questions? Okay.
Okay, thank you.
Thank you, guys.
That concludes our COVID-19.
We're concluded, okay. Thank you so much. Is there any public comment?
I will fill out my sheet. Good morning. My name is Mark Avery, A-V-E-R-Y. I reside at 3 Diamond Ridge Way, Ocala, Florida, 34472, and I'm the president of the Marion Education Association. And yes, I believe you have an obligation to protect our students and our staff. If we had all of these systems in place last year, and we barely could keep everybody at school. We were very fortunate not to close any school down or any bus loop down, and we had some serious hiccups along the way. In some schools where the entire grade level was possibly going to be quarantined, and we could keep 10 kids at school, and we did that. And that's a reality, and we took every step we could. And now we're saying we're not going to take those steps, and I heard the last work session that we're going to try to do education as normal as we can, but we will also try to do some COVID mitigation practices. We're not being consistent. I understand that the parents want the rights for their students, but what about protecting our staff? Because the staff were nervous last year when everybody was wearing masks. Now you're going to tell them, I'm going to fill your room And we know that the majority of our schools, you cannot social distance the way that it's described. And we're going to fill the room with students. Whether they're sick or not, they can still be carriers. Just like if we're vaccinated, we know that that's not the perfect fix-all. Also, that people that are vaccinated are still getting sick, unfortunately. I'm not the CDC expert. They said if you don't live in my home, even if I'm vaccinated, I should wear a mask. Thus, I have the mask because I did get vaccinated. I think we have an obligation to do this. I know it's a difficult step. And then I don't know how any of us that have a teaching certificate could stand here and say, I'm not going to protect the students to the best of my ability. Because we punish teachers all the time for not being ethical and harming students. And we have an opportunity right now to protect every student and our staff, and you have a dual role there. And I think we can do it. We make rules all the time in our district to protect the masses. We have a whole safety department that spends their entire day to protect our schools from an unknown or unprescribed danger. We know this danger, and yet we're still going to choose to possibly look away. And I think we're missing a piece there. I don't have the right answer. I know we have different districts around the state doing different things, but this one is a lot more dangerous to children. And definitely in some other areas, they are having huge spikes with children in hospitals. And my colleague in Alachua County, and if you read the paper, saw the quote, there's not enough money to challenge against the student's life. And that's really what we have to think about. We're here to protect all the students and educate them the best we can, and also protect our staff. Thank you for your time.
Is there any more public comment? Seeing none. Thank you.
Thank you.
All right. So we could either take a small break now and then come to our self-funded health plan, or we could work through this and then take a break after, or we could take a break both times. Because I know Miss Boston-Ellis is going to be long, but I'm not sure. Do you guys need a break, or do you want to push through?
Pushing forward because
Okay.
we have some folks in the lobby that have been here for the whole morning so far.
Sounds good. Okay, so now
Can we take a break before Miss Boston-Ellis has her?
We will. I'm just trying to get a feel for what you guys want to do.
I mean, that's Campbell. I'll use Cummings' line. That's Campbell. That's.
Are you good, mister? You do? Okay.
Take a break now.
We can move without him. He doesn't have to be in here. Okay, we will move forward now with the 2022 renewal rates for our self-funded health plan with Miss Lori Lively, our Director of Risk Management. Good morning.
Good morning, Vice Chair King, Ms. Campbell, Reverend Cummings, Ms. Boston-Ellis, and I understand Dr. Gullett is remote, and Ms. Prestipino. Excuse me. So yes, this morning we are going to talk about the renewal rates. Sharon Leach, our actuary from Gallagher, was not able to join us today. However, she did prepare an actuarial analysis for us, and Thomas Buss is going to go ahead and start with the presentation and discuss that as well.
Good morning, all. Thank you for having us. As always, we appreciate the opportunity. On behalf of Risk Management, we look forward to answering any questions you have as we've prepared recommendations for the 2022 self-funded health plan analysis. So a few updates, if we can move through the slides. Thank you, Lori. We have claims data through May in the presentation here this morning. We have gotten some subsequent information that I'm going to highlight just verbally, but I want to focus on this for your initial point and update from what we last discussed. So the program is continuing to run very well, about 400,000 on average less this May as compared to an average of last May. Plan cost is down about 8% through May, which has resulted in a loss ratio about 2% less than where we were last year. So things trending as we've seen through your prior discussion with COVID. We've continued to see things hold, if not come down slightly. As we look at key indicators and drivers, pharmacy is always one of our focuses. You'll note that through May as well, pharmacy is down about 2% as compared to prior period. Medical claims, however, and this is just a statistical approach, they're somewhat adversely up simply due to the fact claims were so low last year. Right? They came down. We saw that dip in the curve. They're coming back to what we would define as a normal utilization set. So even though the statistic at 11.6 looks high, it's averaging back out. So as we take a deeper dive, here's the projections that the actuary has prepared for next year. Lay of the land on this spreadsheet, you'll see your categories in the left column. 2021's plan year, which we're in the middle of now, and then recommendations for how we expect that this plan year to continue to play out, and then projections for calendar year 2022. What I'd like to draw to the board's attention this morning is through May, with assumptions at the bottom. If I could draw your attention all the way down to the bottom section. The actuary, of course, looks at medical trends. This is locally, statewide, nationally, looks at pharmaceutical trends. As we have a much clearer picture as compared to what we've had to rely on in the past, right, of where do we expect your claims to proceed. So with those 6% medical trend assumptions, 9% increase in pharmacy trend assumptions, know that is included in these calculations as we project forward. Okay, so back to the top. Let's start with 2021. The first categories we look at projected expenses. That's a combination of medical and pharmacy. Through the end of this calendar year, based on May's numbers, $36 million is the estimated total medical and pharmacy claims. With the self-funded health plan, as a reminder, we have what are called fixed costs. That's your stop-loss insurance policy that we purchase for catastrophic events. That's your administrative fees, your wellness program is a representation of that internal expense item. And the PCORI, let me explain that very quickly. It's a part of the Affordable Care Act when it was first started. Self-funded programs have to pay that fee, which is the acronym for at the bottom. The footnote reads Patient-Centered Outcome Research. It's a component of ACA's research mechanism. So every self-funded plan pays that. So that gets you to a $5 million or $5.3 million fixed cost item. So a total expense of about $41 million for projections through the end of 2021. So based on what you're currently funding your program to be, the projected total board and employee contributions, so we call this revenue into your plan, is the $49 million number as we continue down, which results in a projected positive gain or a positive position to your health plan of approximately $7.7 million. We have talked in the past about the importance of your health plan reserve requirements, but also where have we started? Again, a testament to your leadership, Ms. Lively, Ms. Boston Ellis, administration, and you all being good stewards of that prior ProShare money we set aside. We provided you an update, I believe, via email, but just as a reminder, you all now have a cumulative balance based on the last 6 years of plan performance of about $3.6 million. If you see those two opening ProShare fund balance and distribution as of May of this year, combined about $3.6 million, which most self-funded programs in their first year don't start with. So that's our real icing that we've been fortunate to have, right? So if we add that $3.6 million to a hopeful, again, these are projections, end of this calendar year of 7.7, that's how we arrive at an ending fund balance of approximately $11 million. Okay, that's good news. Now, right below there, what does the state require? Remember the state OIR, Office of Insurance Regulation, says, hey, we need to have 60 days of claim reserve set aside. That's $7.4 million. There's your 2-month number. And then incurred but not reported reserves, separate category, IBNR. Those are an example of claims that, Dr. Cummings, if you went, you had a procedure done. Claim hasn't hit Blue Cross's system yet. We know it's a liability out there, so it has to be a projection and a future component of additional cost or liability to the plan. Does that make sense? Okay. So with that, you combine the surplus requirement from the state, the IBNR. Conservatively, we're saying to you all, $9.9 million needs to be set aside in reserves to meet these requirements of future liabilities or unknown liabilities. So if you compare the 9.9 to the 11.3, we still have a bit of a margin. That's good news. I want to draw your attention now to calendar year 2022. Same flow, okay? Again, we're projecting forward with medical trend, pharmacy trend remaining approximately the same. We know the variables of COVID we're going to talk about are still here with the variant. We also know that in the summer, for seasonality of your plan, a lot of people do utilize care more heavily in the summertime, have time to do so and recover. We see the same seasonality over winter break. Okay, so with that, if we go back to the top, you'll see with the assumptions of medical and pharmacy trend, a total claims increase to 42.6 million. You're going to note that your net retention or fixed costs have increased slightly, and that is due to your stop-loss policy. Your stop-loss policy at this point in time is what we call an immature contract, meaning when we started this year, any claims that Blue Cross had at the tail end of last year on a fully insured basis, they were still liable to pay. So in January of 2021, February of 2021, our claims liability is very, very low because that's called run-out in insurance. We didn't have that liability during those months. It's going to catch back up, and it's starting to. So with that, the stop-loss carriers are now saying we now have a soon-to-be full 12 months of what's called a mature contract. We have a better feel of what's going to happen. A mature contract period, which we would transition to, equates to a different cost. If we leave your current stop-loss deductible at the same level, which is $300,000, that's the threshold of which we have a claimant that reaches $300,000 in total claims. If they exceed it, your stop-loss insurance policy triggers. Anything under that, we're paying the claims out of your health plan. If we leave that at $3,000, we're building in an assumption. Again, this would be finalized in October, November, but we are showing an increase of about $500,000 to that stop-loss policy if we leave it where it is. So that reflects the slight increase you see in your fixed cost line item, which at the end of the day, as you look at total expense, you see a much smaller projected gain in 2022, 2.5 million. You see that line item. So a much different story as we move forward, correct? The margins are tightening, still in a great position to an ending fund reserve balance of 13 million in 2022 with a state requirement and IBNR requirement, same process we just walked through, of 10.7. So as we look at these assumptions and go through to the next slide, key takeaways to this board. Yes, sir.
So there's no pro share for 2022?
Correct. Once we've transitioned, Reverend Cummings,
once we transition out,
self-funding, the pro share goes away.
correct.
And maybe another way of thinking of that is instead of relying on Blue Cross after their margins to give us half of your money back, now you pay Blue Cross less, you're assuming more liability, but you're keeping 100% of the margins that you're retaining. That's the advantage of self-funding. Great question. So to the considerations board for next year's budget, as mentioned, the stop-loss renewal is certainly a variable for continuation of cost. Just getting into your second year of self-funding, we have a COVID variant. We have a slight increase in your state requirement and your incurred but not reported requirements. And we know that trends are still better than they used to be reported to us, but still a reportable factor. So before Ms. Lively presents to the next slide and the recommendation, I do want you all to have the knowledge that prior to us being able to tweak this presentation, we have received subsequent claims through June. In June, Marion County Schools, remember the comment I made about summer and seasonality? You had the worst claims month in the history of Marion County Public Schools in June of 2021, 4.8 million. Okay? So as we get into recommendations, I want you to know that we expected that, right? The curve came back. That's not COVID. I have rescheduled my elective surgery.
Right.
I put off the knee replacement, right? So there it is. That's what we've been waiting for. So if you spread that backwards over all the months that they didn't have it, right? So there's where we're coming to neutral.
Right.
So we still need to be good stewards and conservative about where this is going to project forward. We have updated this. It's not as rosy as these numbers reflect. So I wanted to make sure you all were clear on that. We'll bring that back to you in our next opportunity. The timing just overlapped, but I wanted to make sure you were privy to that information. Okay.
Okay, so for today's main goal, and we've talked about this in a few other work sessions previously, we had made the recommendation and suggestion to the board that we ask for an additional 4% increase from the board and to receive consensus for that today in order to move forward with a board formal approval before we go into enrollment. So you can see the figures. The current 2021 contribution from the board is the $583.39, and at the 4%, it would move to $606.73. And you can see the estimated annual cost, which, as we know, it's fluid based on the amount of employees enrolled, and that always fluctuates. And additional difference of approximately $1.7 million. That would allow for no increase to employees, and of course, retirees would absorb any increase that gets passed along. And actuarially, we feel like the 4% would keep us with those margins of some of the unknowns with COVID, with the incurred but not reported claims, so that as we roll into finishing our first complete year and move into next year, we'll be in a better position not to have to worry about maybe we're too close, maybe we haven't hit the number, and from there, we'll just see how claims go. We feel strong that the plan will continue to do well, and hopefully we'll be able to come back and say we don't need anything additional next year, and be able to move forward with some of those years and reap some of those gains of the money that's not going back to Blue Cross that we are keeping. So again, today we seek your consensus to go ahead with a formal board item with a 4% increased contribution from the board.
Or do you have any, Ms. Campbell, you have anything?
As long as Ms. Boston Ellis is good with it, that's my only, I mean, this obviously is a board expense. I'm grateful that it's not going back on our employees, that they won't have any additional contribution, that they will have to up their portion of it, and this would be, I'm assuming out of general fund, or how are we making up the 4%, Ms. Boston Ellis?
Yes, thank you. We are aware of the potential increase, and every year we have an increase. This is by far the smallest one that we've seen in a few years. Because the internal service fund, which is where our self-funded is housed for accounting purposes, is separate than the general fund, there is a transfer. So the expenditure will be transferred from the general fund to the internal service fund for health insurance. But we've been talking about this increase for weeks. We will meet again next week to look at those claims and any other information that's received. And we'll be following it as much. As you recall, last year it was half of a year because the policy is a calendar year in our fiscal year. And typically, the increase that we would see in a fiscal year would be half of what you're seeing. So this would be a 2% impact on the fiscal year 21-22. And we would see the full impact of the 4% the following year. So, but we are aware of that, and we'll make adjustments as we need to.
And I think the most important thing that you said for the record is that in prior years, this number would be a lot larger than 4%. And I think it speaks to going self-funded, because if you're reliant solely on outside third-party health insurance provider, and that's all we're reliant on, then those numbers can be 10 to 15% increase on an annual basis, and you never really know how to dictate how that's going to look on an annual basis. So I think that's the most important thing. Thank you for the information about how the money's going to move around, but saying that this is actually much lower than what we had seen in years past just speaks volumes as to what this board did to go with self-funding. I think that's definitely in the right direction.
Vice Chair King, if I may. I would also like to mention that when I was looking at the claims expense or the premium claims expense during the year, there was a month there was no expense. And I realized that had to do with COVID. And I asked staff, is this true? And there was no expense. So I see this June as taking the place of what didn't occur earlier in the year. Because I don't know that I've ever seen that where we didn't have a claims expense in any particular month, or it was very small. So we will continue to keep you alert as to what's going on. I think they are doing a very good job transitioning to self-funding in its infancy, and we will continue to follow and make sure that you're all aware of any changes that need to be made.
Thank you.
Thank you.
Thank you so much. Mr. Cummings, do you have anything?
No, I understood completely this report. I understand about, as Ms. Boston Ellison, you just said, about there was no month with any claims, and June was big. It's just correction, basically self-correction.
Yes, sir.
So, no, this is low, so.
Very good.
Okay, so our last slide, our next work session is scheduled for November 18th. By that point, we will have solidified where the stop-loss insurance ended up coming in as far as cost goes. So we'll be able to talk to you about that. And by that point, we will be just wrapping up with enrollment for the year. So we'll be able to talk a little bit about how that process went. So this is the cycle we're kind of on, renewal figures, wrap up with the stop loss that unfortunately happens later beyond the time that we have. We could not wait till that point, obviously, with enrollment. And I think we're starting to get into a little cycle each year of how often we need to meet and what we need to talk about as compared to how we used to do that with the full insured program. So I think by next year, we'll feel a lot better of the flow and have a better idea of where we're going.
Thank you so much. Is there any public comment? And none. Thank you.
Thank you
You
all.
guys do a great job as always.
Thanks so much. Great to see you all.
It's great seeing you too. Okay, so we will go ahead and we're going to recess for 10 minutes and then we will move on to our budget. So we are recessing at 10:34. boring. Don't take it. Okay, we are reconvening our meeting and we will be discussing budget, our general fund with Miss Boston Ellis.
Good morning again.
Good morning.
This is a great opportunity. We look forward to sharing information with you as it pertains to the next year, this year's budget now, as well as the prior year budget and actual expenditures. I do want to remind you that this is a tentative budget. Since this information was compiled, we have had additional expenditures, received some revenue, but as we always do, we will provide a reconciliation between what you approved as a tentative budget to what we submit to you as the final budget. So what we'd like to do today is recap about the all funds summary. We will look at the items that impact our local taxes, such as the property value and millages, the state Florida Education Finance Program, and then we'll look at each fund. We won't go into very much detail, but we'll try to highlight some of the things that may be of interest to you. I do have Thomas Dyke with me this morning, who has pledged not to speak, but I wanted you to know that this is the person who maintains the bulk of our budget, which is salaries. Thomas is in control or manages our unit control and budgeting those staffs, and he is here under duress. Okay, Thomas.
The toy is not here.
Everybody think of some questions to ask him now.
Okay. If you'll go to slide number 4, again, a recap. Our total tentative budget is $698 million. This is behind tab 3.
Thank you.
Apologies. And today we'll be focusing on the general fund adult ed, and also referendum. And combined, these three totaled $442 million. The tentative budget, again, as I stated before, is $698 for all funds, and our prior year total budget was $652 million. So that increase is predominantly related to the Internal Service Fund, self-insurance. I mentioned a little while ago that the first year it was a half a year, and this year it is a full year, full-blown self-funded plan. What we're talking about today, again, are those three operating adult ed and referendum funds, and they represent 63% of our total budget. So that's the vast majority of our budget. If you look at slide 6, you know that we're governed by the Truth in Millage Act, which we call TRIM. We have passed the first 3 boxes, and we are now between box 2 and 3 on the second level. So all these things had to take place based on a certain date that is indicated through TRIM. So right now we are in between day 35 and day 55. The next things that you'll see happening is our community will start receiving their TRIM notices, tentative bills, in August. And that's when we typically start getting the calls from some of our community members who ask why that we are, why they have to pay school tax when they don't have children in the system. And so when you get those calls, we just recommend that you share that this is the law of the state of Florida, and this is how we fund the public education system, and we do appreciate their contribution to future policemen, to future teachers, and all the other people who would support this community that they live in. On the next slide, we give you some indications of how property values and the total millage rate. As you can see, as the property values increase since 13-14, there is a tendency for the millage to go down. In the 1 year with the spike, 15-16, that was the year that you approved the referendum, the 1.0 mills. There is also a handout behind your tab 7 that gives a history of the millage since 1999. And I would like to point out to you on that attachment, that handout, at the very bottom of it, you'll see in the 21-22 year, we have $24.6 billion in taxable value, and based on the millage rate of 6.903, it should generate $163 million. Also want to point out on that attachment, that millage history, if you look on the third, I would say the third set of numbers, you can see where the property value started to decline in 2009-10, and that was when we started, the economy was adversely impacted, and you can see how that impacted the funds that we received from the local community. The uptick started in 2015-16. We started seeing property values going back up, and they have continued to increase. I think our increase this year was probably by far the largest, about 9%. So we want to keep our eyes on that, because that ties into, and it may impact us from an inflation rate. We don't want to go back down again and lose property value. So we have to keep our eyes on that, because I think that goes to speak toward our community growth. The next slide is just a pictorial about how the millages look compared from 2020-2021 year versus the current year. As I stated prior, it's like a 9% increase in the taxable value. And the following below that are all the different millages that are levied. The first is the required local effort, I'm sure you're all familiar with, and that is what the local government has to contribute in order to receive the state funds. The rest of them are considered discretionary, operating, local capital improvement, and of course, the voter-approved millage of 1 mil. So if you look at the very last column, all the way down, you'll see that the total millage rate decreased 0.115. On the next slide, it gives you an indication of what does that 6.903 mil generate. And for Marion County, if you look in the middle column, all the way down at the bottom, this 6.903 will generate $163 million, which is $11 million more than last year. We have two examples. The first example shows the impact of the millage change if there is no increase in assessed value. And we know that does not happen, but this is just to show you, because of the reduction in the total millage rate, there would be a reduction in the increase of taxes paid from last year to this year. Our example number 2 ties into the Save Our Home legislation that was provided in 1995 that basically limits the increase of your property values, the lower of 3% or the CPI for our area. And for our area, for the state of Florida, 1.4%. So the example here shows the $200,000 home having an increased value of 1.4%. So now that is $800,000. You reduce it by the homestead exemption, and then it calculates what your taxes would be. And again, in this illustration, you still are paying less than what was paid last year. And if we continue to add scenarios, of course, it would show an increase eventually. But this is an illustration of the impact of Save Our Homes. So let's leave the local and move to the Florida Education Program. I love to talk about that this is Article 9, Section 1 in the Florida Constitution, which established the commitment that our community made to the public education system, the K-12 system. And the FEFP program, Florida Educational Finance Program, was established to create a parity between different locations, whether you were living in the Panhandle or down South Florida. And it also takes into consideration the type of services you provide to students, whether they're exceptional or whether they're basic, whether they're a vocational teacher. And it also takes into consideration where you live. So this is the primary vehicle for funding operations. And it's typically recalculated 4-5 times a year, but last year was the anomaly, and we did not get the February count due to COVID. So let's review on slide 15 what those major funding components look like. You take your full-time equivalent students, and that is multiplied times those program cost factors, depending on what program the student is in, and that becomes your weighted FTE. That is multiplied by your base student allocation, which is what every student in the state of Florida is allocated. And then that's multiplied by what is called the district cost differential, which is the DCD, and that's basically the cost of living in our county. And then there's other adjustments, which include whether we have a prorated or a prior period funding adjustment or categoricals. And we'll look at these in detail. And here is that formula as it impacts Marion County. Not very easy to read, but just wanted you to get a flavor of what it looks like. Those are our projected students, 42,734 for this current year, which is down from the prior second calculation. Then you go on to the weighted FTE, the base student allocation times the DCD, and that is our base funding. There are other adjustments made, the 0.748 mills discretionary compression. What they say in law is if we levy the full mill, we will get an additional $9 million. So if we levy the full 6.903 bills, then our district will get an additional $9 million. So even though it's discretionary, it's probably something that we want to do. And then the funding compression allocation, you may recall that that was enacted a few years ago, and we started out probably almost $3 billion with this funding source that is basically because we have received our funds per student is less than the average funds per student in the state of Florida. So this was an additional adjustment. What we have noticed over the past few years is that this number is going down as it is being tweaked by different adjustments to that formula. And then the green or the dark coatings are all of our what we consider as categorical dollars, which are funds that we are allowed to use, but they have specific requirements, such as safe schools can only be used on safe schools. And our reading instruction is for reading, it's very specific, and so forth. A new one, or has been around a few years, which is growing, is that mental health allocation found on the third line, and that was $1.8 million, and that was an increase this year. So it includes things like instructional materials, digital classroom, and then turnaround supplement. That decreased as well this year because of the exclusion of Evergreen. And then, of course, our teacher salary increase. You may recall that was a new revenue last year. This year it is back again, but we received about a $600,000 increase as it relates to teacher salary increase. Another item on the fifth line is the class size reduction. Bring to your attention that has also been recalculated, and you will see that we're getting less funding for class size as well. So our total state funding is $221 million. Our total local funding is $103 million. So our state and local is $324.8 million. When you add in all the additional revenues that we receive for the various miscellaneous resources, that revenue is up to $345 million. So let's look at every category. You've been hearing how our FTE has gone down. If I can take your attention to the year 2019-20, we had 43.2 thousand FTE, and then last year it dropped to 49.9. What was very fortunate for all the school districts in the state of Florida is that the state held us harmless, and our district actually received $11 million to offset some of that reduction in revenue that we could have received. We are estimating and projecting that we will get back up to at least 42.7. And again, we will have to begin watching the numbers more and more closely because we have been informed that there will not be any grace this year in terms of funding as it's associated to students. Mr. McGowan mentioned in his presentation about the efforts that are being made to find our students. I will also add that a part of the federal dollars that we are receiving, the legislators said that we had to allocate a certain percentage of that, and that is to find the students, to work with other agencies in order to find our students and get them back in the classroom. And so we had to amend that application that we had started pulling together to make sure that we had the right amount of dollars that they had associated with finding those students. Another important component is the program cost factors. And while on the surface it doesn't look like it's very much, it does impact the funding based on the type of programs that we are serving our students in. So some of the program weights increased over the past year, some of them decreased. The highest one impacted is what we call the ESC support level 5. That went down this year, as well as the basic education 912, and then also the vocational programs. A lot of that information is built when all the costs from all 67 districts are accumulated. We have to put together something called a cost report, and that allocates costs to all the schools and all the different programs. So this is the way our governing body delegates what a program costs and how we should be funding it. The next slide is our weighted FTE. Remember, that's the base student allocation times those other factors. We come up with a weighted FTE. We are indicating that we will see an increase of about 1,000, which is a positive, but when you dig deep into see where those increases are coming, it's basically our ESC programs, which of course cost more. And here's our base student allocation. As you can see, there's an increase of $53.42. The only thing I would share with you here is between the 17-18 and 18-19 year, you may recall that we only had an increase of about 40 cents. So the base student allocation is supposed to indicate the health of the economy, and hopefully that will continue to climb as costs continue to escalate. You should have another handout, and it should say the 2020 Florida Price Level Index. As I stated before, this is basically the cost of living in our community. What I want to point out to you on this, if you look at this price level index, if Marion County has 93.51, 93.37, and 93.59. What I found interesting is if you look at our neighboring economies, Lake has a higher cost of living, Sumter has a higher cost of living, Alachua County has a higher cost of living. I feel that's it, and that to me is interesting because we're so close, and that determines the funding. So if they have a higher number, then they get more dollars. So what I did is I took the Lake County's price level index and multiplied that times our base funding, and we would have received, say, $6 million more if we had that same cost of living index. So that is an important factor. What they look at is the cost of housing, the cost of the economy in our area. But I found that interesting that we are so close to these communities, but yet we have a lower cost of living than they do.
Our teachers that are looking elsewhere need to be paying attention to that. Anybody who's considering moving to one of these other locations, just take a look at the differences in cost of living.
So we end up on the per pupil funding, and for our county, it's $600.49. What I'd like to point out to you is that the average per pupil funding for the state of Florida is $7,811. So we're basically funded about $210 less than the average.
That's the state average.
Yes, less than the state average. All these components go into, why we are where we are in terms of funding. And I think it's just important for us to kind of understand that. So we're moving past all that, and we'll start looking at individual funds. The general fund operating, our total revenue is $405.6 million. What I would like to point out to you here is you'll notice that the beginning fund balance is $60.5 million. And we went back and did some research. Thomas did some research on what caused this, and I would just like to give you some of the cliff notes. During the year, we noticed that there were over 100 plus vacancies in teacher positions. So that was money we did not use. Also, we had vacancies in our transportation area to the tune of over 100. We did not spend as much money for fuel, diesel and gas and electricity, but what I did notice as we were getting bills for the month of June, that was not included in here. So I'm saying 60 million, but I expect that number to change, to get lower. And then also substitutes, we paid about $1 million less for substitute costs. And then the other item I'd like to bring to your attention is that we didn't travel as much, and some other miscellaneous expenses were not. So that totaled up to how we got to about $60.5 million beginning fund balance. I think we can move on over to slide 26. Basically gives you a summary of all the different revenue sources, but if we can just go ahead and go to slide 27. And one of the components of the revenue we get is federal and federal through state. That's your ROTC dollars. We do receive some portion of a reimbursement from the armed forces to cover the cost of the teachers and some of the supplies for those programs. Medicaid, those are our Medicaid eligible students. We receive some funding from the federal government. What we use for that is to offset a lot of the costs associated with therapists, a lot of speech therapists, OT therapists. So we use that revenue to offset some of those costs. And of course, our national forest funds, we receive a portion of those dollars for what happens out in the forest. and we share that with the county. And then sometimes there's some miscellaneous revenue. The next is our state operating revenue. What I'd like to point out to you is the FEFP has decreased from budget to the tune of about 8.6 million. That goes back to the adjustments that were made in some of our categoricals, as well as a projected 1,000 less FTE. Class size, again, was reduced by 4.8 million. That formula, again, was tweaked during the legislative session. Slide 29 is our local revenue. Again, district taxes increase based on property values. And then we also have some reductions in revenue for various programs that are amended in through the year. The other financing sources on slide 30 really are transfers from our capital to cover where the charter schools funds for PICO. Remember, the charter schools do receive PICO dollars, but in order to pay them, we have to transfer that money from the capital project to the general fund. And then also we transfer 4.5 million for maintenance, and of course our property insurance, 1.6 million. So as a synopsis on slide 32, we have, when we compare the adopted budget versus the tentative budget for the current year, we have $8.4 million more in expenditures, and we've indicated where those areas are increases and decreases. So we're going to look at the general fund operating expenditures by object. The first one is salaries, and I think you have 3 handouts for that. Basically, one of them is the general fund operating percentages. It's comparing them from year to year. Another one is the general fund operating units, comparing those. And then an assignment by object, so that you can see what object we provide, where we record teachers, where we record things like content area specialists, where we record bus drivers. So that's informational purposes. The adopted budget from last year was 217.6 million. It's an increase of 218.7 million. What I'll share with you here briefly is that at the classroom teacher level, that reduction of 3.4 was basically, we had a TSSA reduction of 1.5 million. That was that the turnaround school. Remember I told you it went down, and now it's hovering around $200,000, and that money goes to Oakcrest. But the turnaround supplement was basically Oakcrest and Evergreen.
They're getting it this year.
Yes.
I know we passed it last, I think, so they will continue to get it.
Yes, Oakcrest will.
Okay, perfect. Okay, thank you.
And I think they're eligible for additional funds that the governor released a couple of weeks ago. It's like 44 million for district or school, county, statewide. And I think our portion of it is 290,000, and those dollars will go to Oakcrest as well. We also had a reduction in about 32 teachers. I know Dr. Gullett has shared with you on several occasions about how we rework the ratios and the allocations, and based on those ratios and allocations, and of course the reduction in the number of FTE, we are down by 32 teachers in terms of the budget. In the other certified instruction, we have 3 new program specialists And then there was also some additional changes, one for mental health, health psychologists, and then the teacher salary allocation increase. Originally, Thomas had budgeted that all in the teachers, but that also is allocated to other qualified folks that are in other objects. And then in the 1600, there was a reduction of about 13 paras, and in the, I think that was in the paraprofessionals. And then other support personnel, there's various deductions in units and other adjustments. So we go to the benefits on slide 35, 74.8 million. The adopted budget last year, 79.2 for this year. Our main increases were in the area of retirement, which that increased several percentage points this year. Also want to point out to you that unemployment, as you know, in the past, that was usually a small dollar amount, about $50,000, but based on the happenings of COVID and unemployment, we were being charged for some of our employees that may or may not have qualified for unemployment comp. But until all of that is reconciled, we had to pay that bill, and we're budgeting about $450,000 this year. We will not receive money back. What we will receive are credits. So it's going to take a while to get all that refunded. But that was one of those unexpected items that happened last year. Okay. Next, we'll look at purchase services, 34.3 million in last year's budget, 38.7 in this year's budget. There's an increase in professional services. That's where we record the Family Empowerment Scholarship and the McKay. We have an estimate in there from DOE, but we also are reserving a little bit more just in case that number increases. I'm on a call this afternoon to find out if DOE will give us a better estimate of what the Family Empowerment Scholarship and the McKay, because they pretty much open that up. It's pretty wide and broad now. Will include siblings, and a lot of the criteria and the other scholarships have gone away. So we anticipate this to go up. So that's why you see that $4.4 million. And also what we did is, and I'll talk more about that in a little bit, but because referendum does not allow us to pay for anything other than operating expenses, we have moved the resource officer's costs to referendum so that we can in turn take that budgeted dollars and push out more funding so that Safe Schools can go ahead and finish up the fences and the door buzzers and the cameras in the schools. I understand there's a little hold up in terms of products that they need to build those, but we made this switch so that we can speed up that process. Energy, I think we talked a little bit about energy services on slide 40. I'll just point out to you that it looks like we had a lot of money left over in electricity and diesel fuel, but since we have received those bills, those dollars will go away, or that at least the changes from budget to budget and budget to actual will be different by final budget. Other materials and supplies, nothing really outstanding there other than you'll see on slide 42 textbooks. We have been carrying over the textbook categorical for a few years till they had enough to push out and get that ELA for elementary. So you'll see that number has reduced $2.1 million. So I believe in the month of June, most of those categorical dollars were used up. On slide 44, just want to point out to you just a couple of things. Under furniture and fixtures, that's really like computer hardware. There are some desks in there, student vests and harnesses used on the buses, two-way radios, TV cameras as such. Under the object 6100, of course, is library books, and also under building and fixed equipment, lest you think we've gone out and added to the buildings, that's really those chillers and compressors. So when you add those kind of high-level expenses to a building, you have to capitalize them, and it becomes a value associated with that building. I think that's it for that. Other expenses and transfers, again, on slide 46, dues and fees is really those virtual fees that we have to pay, fees for IB and advanced placement, those kinds of things. 7,500 are subs and stipends, and then the 7,900 is basically some of the items that we purchase, or some of the categoricals as well that are not spent and transferred over to the following year. And under the transfers, you'll see the 1.8 million they talked about, and that was the pro share, and that money was transferred from the general fund to the self-insurance fund for health insurance. So that's just reflecting that transfer.
Ms. Boston-Ellis, what gets put into the infamous miscellaneous expense, 7,900? What kinds of items get put into that?
Those are typically the categoricals. That's where we will, all those categoricals that were not spent in a previous year, we will budget them in 7,900 object. And then when they identify what object they belong to, they will, as you can see, it started out at 5.7 million.
Right.
And then,
it's like the holding fund, essentially.
yes,
Where we're just, okay.
until it's determined what object they should go in.
Okay.
Thank you for asking that. Okay. So let's talk about fund balance. You know, that's the excess of our assets over liabilities. We know that the legislators have required us to reserve at least 3%. Our auditors recommend 5 to 7%, and our financial rating agencies who determine the value of borrowed dollars that we have or use, they recommend double digit. So the whole idea behind a fund balance is to have funds for rainy day, not to use them for recurring items. So it gets a little tricky sometimes when we are projecting fund balance and how we actually use it. But what I've noticed since I've been here quite a few years is typically the money we save in 1 year, we use it to help us fund the next year. So there's several classifications. We are looking at submitting to you a board document to create a policy that talks about establishing a committed fund. And the difference between committed and unassigned is that we will basically say we're going to set aside a certain percentage of revenue and keep it in that committed fund, not touch it unless you say it's okay to touch it. And it would help us through these times like COVID, when we're worried about flexibility of funding and whether or not we can find all the students that are missing, or just to be ready for any unforeseen item that happens. So we're going to bring that policy to you for your consideration to at least.
I'm sorry. So it becomes like a reserve fund, essentially, that we would then have to approve what would be used, what it would be used for. Okay.
I'm glad to see that.
I know, me
'Cause
too.
We've been working, I think we've talked about that since
Several
I've been
years.
here. And it was always, I think, stick a pin in it. Stick a pin in it. And so now that I see this, I'm like,
It's a big decision, because that's saying we're going to put this money aside, and our recommendation would be 1%, but it could be 0.5% until we build it up to a certain dollar amount, and then leave it there until we need it. So, and you can.
And would the idea be it would be invested in some way so that it would, okay.
Yeah, all of our not used funds or excess funds are invested.
Right.
Only right now, the rates are pretty low.
Right.
Okay, so you have another handout that talks about general fund operating actual fund balance. And then you also have another handout that has the general fund budgeted fund balance for the 21-22 year. And this talks about those categories that we have currently. It's sort of better to look at it on the pie chart than the bar graph. Basically, when we talk about financial condition ratio, these are the things that the credit rating agencies look at. And at the end of the 2021 year, it was about 14%. That's what they want to see. But we know that those dollars were inflated because of COVID. And that's really not what we typically see as a financial ratio. So restricted, of course, are those categoricals we talked about. Non-spendable is inventory, prepaid, so anything that we have in inventory, we have to assume that will be expensed, so we have to reserve for that. And then, of course, the unassigned, which is not only the 3% requirement by Florida statute, but also any excess funds that we had available. And we're also allowed to assign a certain portion of the budget from a prior year to offset the deficit from the next year. And we assigned $21.8 million. And then the other one is just what we're projecting for 21-22 budgeted fund balance. What I'd like to point out to you here is that the assigned is for family empowerment and McKay that will be in excess of what we already have expensed. So as soon as we know that, what that may be for our school district, we'll be able to adjust that, hopefully down. Are there any questions on general fund operating? If you think of anything after, shoot me an email. We'll bring back answers the next meeting. Now we'll quickly go to adult education. You may recall last year that they ended up in a deficit, and I'm proud to report that they are now solvent, thanks in part to, as you will see, them really looking at their cost and reallocating expenditures and tightening up the programs that they have. So you'll see in the analysis where you'll see a lot of decreases. Programs aren't gone away, but they have really shored up and aligned the fees collected and the revenue they get from workforce, align that to their expenditures, I think, in a better way. So we can go right ahead to slide 54. Their revenue sources are pretty straightforward. They get a workforce allocation that tends to stay the same almost every year. And then, of course, the local are the fees that students actually pay. We'll skip all the way to slide 59. So the change in their budgeted expenditures is $1 million less than the prior year adopted budget. You'll see reductions in things like salaries, benefits, energy, all of their costs have been reduced. They were also in receipt of some CARES grants, so that has helped them as well to shore up where funding was short. The next few slides have to do with salary and benefits. There is a handout that shows you the change from 2021 to 21-22 in terms of budget. And it also gives you the units for MTC. I think they have about 54 either full-time or part-time employees. Okay. 65 is probably the next expenditure. Again, you'll see quite a few reductions. The increase in here is $3,600, which are rentals. which are actually, this is something for their practicing nurses, their technology, it's a licensing. Sometimes the titles are a little, they don't really correlate to, but that's where we're told to charge it to. Again, on slide 69, as you can see, there's reductions in expenditures, again, lining up with their program revenue that's generated. It would be the same for capital on slide 71. And then there are other expenses on slide 73. Dues and fees, again, are basically licensing. For them, their CAPE budget has not been amended into it. And also that's where they pay those certification fees, $7,300. So their fund balance on slide 75 is restricted, and it's only for adult education programs. So pretty straightforward. We can go to referendum. Just a reminder on slide 77 that this extension of the referendum for another 4 years was approved August 28th, and it's effective from July 1, 2019 through June 2023. The estimated revenue for this year is $23.1 million, basically tying into the increase in the property value. These are all the programs that are being supported, as well as Safe Schools. So Thomas, if you could take us to slide 79. The beginning fund balance was $5.5 million. And what I always tell the ICROC committee is that we need to have a decent fund balance because tax proceeds don't start coming in until November. So the fund balance at the end of the year is used to carry these programs through until November, December. So we can look at the programs now beginning on slide 83. So the budget for 21-22 is $20.5 million. 41% of this entire budget is for class size reduction teachers as well as paras. You will see that the SRO funding is increased over the prior year, and that's because we moved the SRO cost, that contract, moved it over to referendum. So we can look at each one of the programs, and you can see the change from year to year on slide 84. We have 75 classroom teachers and 117 paraprofessionals. The teacher count is down by 26. Paraprofessionals have been reduced by 77. Physical education, 19 PE teachers and 27 PE techs, down 7 PE teachers and 1 PE tech. During your discussions with employment services or human resources, I think was shared with you that we are looking at attritioning out units as based on the formula, but if someone is in that position, they stay in that position until, and when it becomes vacant, then that particular position is removed from that school. So you'll see some reductions in units, but you'll see some additions as well. The next is vocational programs, $2 million. Basically, they're purchasing online curriculum as well as providing hub bus stops for MTI students, and of course materials and supplies and capital outlay. They're replacing a lot of old computers, Macs, and such that they are specialized to their programs, and they are replacing those items. They also have 20 teachers paid out of referendum. Media services and library media, library aides, and these are really clerical folks, have been adjusted and attritioned out. The aides are, that total budget is $1.2 million. What I failed to tell you on the other slides is that every elementary school gets $2 per student to supplement what their allocation is from their school in terms of replacing PE equipment, whether it's art or music as well. And art, you will notice that there is an art para, which is supporting the larger elementary schools, supporting those classrooms. So that's a new category for art, 11.5 art paraprofessionals. And the same for music on the next page, increased 11.5 music paraprofessionals. Again, each elementary school gets $2, but also we're allocating money to all schools for their music programs, not just band, but all of the different music programs at all of the schools. The next category for new teacher training, $462,000. It's not basically an increase over the prior year because they only spent about $257,000 last year. But they typically request between $400,000 and $500,000. And this is supporting our new teachers, I believe, year 1 through 3. And they assign them a mentor, and that mentor provides just a lot of support to the teachers, and that mentor is paid a stipend. And our last category is safe schools, purchase services, which is the SRO contract, and then some miscellaneous equipment, which can be some cameras, some other hardware to support that program.
So, Mrs. Boston,
Yes, sir.
so with Safe Schools, all of the contracts that we do with Safe Schools, as far as all SROs, is paid out of this?
Yes, sir. That's what we have moved over to referendum, so that, because we could not purchase fencing out of referendum.
So, and do we have an guesstimate on how many people that is, at that 2.4 million of the SROs?
I know there's one at every elementary school.
And 2 at secondary?
There's 2 at certain secondary.
Dependent
The
on
3
size.
large ones.
Some large.
So probably 65, 70 people maybe? I'm just,
I bet Dennis could get back.
no, I'm certain he could.
No, I'm gonna write that down as something to bring back to you, exactly.
It helps paint the picture, like we're talking 2.4 million for how many people? I mean, it's a big number.
Yes, it is.
And that is
I think it's probably like 55, 56, but we'll find out.
That is salaries for the SROs.
That's the contract that covers a portion of their salary, their equipment, and
And for their benefits, correct?
yes, sir. Mhm. Yeah.
So,
And the county has different benefit structure than the city.
correct.
Yeah.
Oh, boy.
Yeah, we'll pay attention to that. I wonder, it would be a question maybe for later, but for us just to look at it and revisit it and, but we can do that later.
It's coming up anyway, so,
Yeah.
as far as redoing the contract.
I think the following pages, we've pretty much already talked through what's happening in the referendum. I would bring you to the fund balance on slide 99. Just reminding you that is a restricted fund balance. We're anticipating 8.2 million at the end of the year, but we have started having discussions about whether or not we're going to expand the vocational program and not just limit it to MTI. I understand there's an equine program starting at North Marion High, and if a student, say at Dunellen, may want to attend that school, if we're able to secure the drivers needed, then we're looking at increasing the transportation for vocational to support more choice in high schools.
So I'm assuming that, like a hub?
Yes.
They have a, okay.
Yes. It would be expanding the current hubs, not just to MTI, but
Somehow.
other areas.
Yeah.
So it may not be 8 million at final.
Yeah, I'm curious what those numbers look like.
All right. So additional information, slide 101. We're always asked, I don't know about you, what happened to the lottery money? So I just wanted to indicate in 2020 and
Billboard campaign.
2021, right, we did not receive any lottery funds. There was, of course, no grades, so there was no school recognition dollars, and we also didn't receive anything else. Typically, if the school recognition dollars are used and there's money left over, they allow us to allocate $5 per student, up to $5 per student, to each of the schools to use at their discretion. So, nothing in the past 2 years.
I don't remember that not being in last year for 2020 at all.
Nothing.
Funds Bright Futures, right? Isn't that what they end up doing?
Part of it, yes. So the very last slide is just a history of that teacher classroom supply assistance fund. You know, that's where DOE is specific about a certain type of classroom teacher will receive additional money to supplement their classroom supplies. Thomas created a schedule for me from going back to 2016. They were receiving $270 all the way up to last year, $317. So 2 factors, if the number of teachers who are eligible at September 1, and then we have to allocate those dollars based on that number and just divide it by the number of eligible teachers. What you as a board has also said, those teachers who do not meet the criteria for this, we are still providing the funding, but it comes from the general fund. So everybody gets this funding. All of the teachers receive this.
When you say everybody, do you mean like the guidance and librarians, or are you, is it?
Yes.
Is that what
Everybody
you mean when
get it,
you're saying?
Everybody that's assigned students.
That has assignment to students.
Assignment to students, okay, thank you.
Thank you, Thomas. He did speak.
You were banned, man.
I know, she got me.
Hey, your reprieve.
Last page.
No, we can't say enough about Thomas. He's come in and revolutionized how we keep up with our staffing, which is, again, the largest part of our budget. Doing a great job, and we want him to continue to be creative and come up with more innovative pivot tables. Are there any questions? Hope it didn't go too fast, too slow.
I have a comment. When I saw it was 103 slides, I was like, oh my God.
I know, I did too.
I said, 103, this is going to, but thank you. You got us through it.
I think that's a compliment somewhere in there.
That's a wonderful compliment.
Somewhere.
You did an excellent job getting us through it. Thank you for the navigation.
Yeah, staff does a great job. I know I probably drive them crazy because we just analyze and analyze all during the year. And at the end of the year, it's an easier process because we're looking at changes. It's just COVID sort of threw us a loop, and it threw away all of our typical analysis, but they did a great job looking at, especially the units. You know, that's always a concern, and that always comes up in union negotiations, fund balance, but I just try to help us all remember we have to be careful about using fund balance for recurring costs, but keeping in mind that we want to support our teachers, all of our employees the best that we can, based on the funding that has been provided to us. And we believe you have done great things in terms of leadership of us staying in line with what we should be doing. So we appreciate that.
Thank you. Ms. Campbell, do you have anything?
Kudos to you guys and credit to you. I also want to give a shout out to Florida School Board Association for their finance forum, training school board members on some of this too, because that also helps us be better leaders and understanding what you guys do and how the calculations occur, and we spend 2 days delving into all of that, so that certainly helps. You made a statement about fund balance and recurring costs, and I continue to have in the back of my mind, and I know this is a conversation for another day, but how referendum is funding recurring costs and what that looks like for us going forward. I think that having that in our thought process, is that what we want to continue to have the referendum do? Do we want to have it continue to fund recurring costs, or is it something that we want to increase program opportunity and then to help fund it? Or I don't, it's a conversation for another day, but in the back of my mind through this entire presentation, and I'm grateful that we went over referendum a bit, but I have that in the back of my mind because I know that's a conversation that we do have to get real serious about in the next year or so.
Well, you say that it's for another day, but to be honest with you, that day is here because we are with the SROs. That is a recurring cost that we're paying, and we're depending on it. And once referendum sunsets or the voters just say no, we've been mandated to have SROs. So we're going to have to do something.
No, I know, and I'm just not certain which work session it is. I know Ms. Thrower certainly wants to be a part of the conversation.
Definitely.
She had talked about, we wanted to increase something, and I mentioned, middle school shop classes and increasing some of our vocational opportunities in middle school that we currently don't have. And I know Ms. Bostonell is like, okay, where are we funding that? Like, what are we taking away from if that becomes a topic of conversation for the next round, if we're pursuing a referendum on an upcoming ballot, then we do need to get serious about that conversation sooner rather than later, to your point.
Yeah, that's great. That's a good conversation. I think it's important that we include Ms. Thrower on that moving forward also for another day. Is there any more comments? No. Ms. Boston-Ellis and Mr. Thomas. I was like, I can't remember your last name. I'm sorry. Thank you so much for your wonderful presentation. As always, please extend our gratitude to your team. We're very appreciative to them. You mentioned, some loops were thrown during COVID, and you guys did an excellent job of navigating this district through that financially. And when I read the paper and what's happening in other districts, in other counties, I am very grateful for your expertise and your leadership to make sure that we are being good stewards of our money and our funds. And it is with your leadership and your team that we don't have to worry about some other issues that, that could be our way. So thank you so much.
Thank you. We couldn't do it without your support.
We're a team, usually. Okay, thank you. Is there any public comment? Seeing none. Thank you so much, and you guys have a great day. Okay, so now we're going to move forward with board concerns. Mr. Cummings, we'll begin with you today.
Again, very, very good, another very good work session. Earlier we talked about the Howard Academy Committee. The 12th will not work because we don't have enough time to advertise and publish it. So I'm going to ask that we do that Howard Academy Committee give their report on the 19th.
On the 19th?
Yes.
That'll work. Is Dr. Gullett still on the phone? Or is she? No? Okay.
Yes, ma'am, I am. I'm here.
Okay. It's also my understanding, I guess given time, did you want to have it next week? Because I think you could maybe bring it up under your administrative briefing, or should we just wait till the 19th for that?
We can certainly do it whatever the board chooses. It could either be a committee update under my briefing, or it could be a separate item.
Okay, so I guess, Mr. Cummings, do you want it a separate item, or do you just want to add it like that, and then we could bring it in that way?
Yeah, that would be fine.
So you do want it on the 12th then?
Well, no.
The 19th?
That'd be the 19th. That'll give that committee, I can contact the committee and let them know so they can be prepared to bring in that report. Because I'm not bringing the report, they're bringing it.
They're bringing it, okay. Okay, thank you, Dr. Gullett. We're going to go with the 19th.
Thank you. again, we had the spirited debate, conversation concerning COVID. I'm very concerned, as I've always stated, that we do what's good for everyone's safety. I want to encourage our staff, and I'm strongly encouraging our staff, if you are sick, please don't come in. We have implemented things to help you, to help us stay safe. So if you're sick, we don't need any super people coming to work sick. Just stay home, get well, do what you need to do, come back when you're better, and let's keep these kids safe. Let's keep these schools open and do what we need to do. And I'm looking forward to school starting next week. Out and about, I was out to Bellevue, glad to be out to Bellevue Middle School the other day. Had a wonderful time with them. Going to be out to some other areas. And let's have a good school year.
Thank you.
That's it.
Okay, thank you. Ms. Campbell?
I echo Reverend Cummings' comments that it's good to have healthy conversation where you can have a disagreement without being disagreeable. And so I'm grateful for that opportunity that we have to express our thoughts and still remain cordial and in a great frame of mind. I also echo his sentiments that if students and or staff are not feeling well, that they stay home. I do want to express, as the newspaper today did indicate that I had recently had a COVID diagnosis, I want to express that those symptoms may not look like what you think they are. They're not the same symptoms that we heard a year ago that you would be experiencing. And so even if you always have allergies, or even if you always have a sinus infection this time of year, or whatever that might look like for you, just understand that it might actually be something different, and it might actually be COVID. So please, even if it looks like something that you've always had before, be cautious and err on the side of caution and choose to stay home until you know for certain that it is what it is. With that being said, I also wanted to remind you, board, that this coming Tuesday night will be the night that I'm going to Orlando for the awards competition. So I will, with the Florida Public Relations Association, so I will not be in person. I may actually try to be on the phone for that board meeting because that doesn't actually start until 7 p.m. in Orlando, so I might actually be able to be on the phone, but I will not be in person for our board meeting coming up on the 10th. And finally, the Florida School Board Association, as you know, Ms. Thrower put me in the position of in our advocacy spot, and it is the time of year where we can submit legislative platform recommendations. And we have until September 1st to do that. So I would like for us to have some conversation if there are some things that we would like to submit as recommendations. We do have until September 1st, so if we need to put that on an agenda, we can, or if we just want to talk about it in the next work. Since we do have so many work sessions in August, I want to put that on your radar to be thinking about what we might want to put forth as our recommendations for legislative platform. And if you would like to schedule it on an upcoming work session agenda, then that's up. We have a couple of meetings coming up that we could do that.
We do. How about I suggest this? How about if at our next work session, if you could just during comments, bring it up, and in the meantime, as a board, start thinking about that and then bring those items then. And then also, have they released their platform yet? Because we usually kind of try to align with them and what's happening district level. Have they?
I think what they're asking for right now is for districts to submit recommendations, and then the platform will be determined. They actually have a meeting coming up on the 7th. We had a call yesterday, and we have another call coming up on the 17th that they may be putting some of that information out. It's my first time serving on the committee,
you're fine.
My first call was yesterday.
Normally, they kind of give us some recommendations.
Usually we know what they are, so we are kind of aligned with them, so we're not just bombarding with a bunch of different things. I mean, sometimes we pick sometimes we have our own needs. That's why I was kind of curious if they've
So they have a meeting coming up on the 17th that they may be hashing some of that out, but I
Okay.
think this is also, they're wanting to have some of this feedback from local districts.
Okay.
No, at least that's what I gathered from this, is that they're asking for districts to submit statewide issues for consideration.
So we meet on the 19th, correct? And the meeting's the 17th. So maybe you'll have additional information the 17th, and in the meantime, we'll be thinking, specifically for our district, or, and we can come together and we'll make our important points. It's good. Thank you for bringing that.
Absolutely.
Is there anything else?
All for me.
Not from you. Okay. Again, I'm going to echo what my board members are saying. If you are sick, stay home. Even if you think you're just a little off or something, please stay home. It could save your life. It could save your friend's life, your parents, or whatever, or whoever, not whatever, excuse me. Also, as far as masks go and your personal well-being, again, I encourage you to contact your physician. They know your health. You know your health. We're board members. We do not know each and every circumstance, and you don't want us to know that. So, take charge of your own health. I understand that there is a lot of apprehension and trepidation with the new school year, but I will remind us that we had these same feelings last year, and we forged through, and here we are and better for it. And again, it's a new year. We know more. We're more informed. We're stronger for it, and we're going to be okay. It's going to be okay. And I understand that, everything's heightened right now, and we're going to keep on working through it. And I think that's all I have today. I think I'll save some of my stuff for next week. And with that, we have no further business in our meeting. Or, Mr. Powers, do you have anything?
Briefly, no, that's okay. Briefly, I wanted to say that recently completed providing some training along with Mr. Tim McCourt, General Counsel for the Sheriff's Office, and Mr. McFadden from our School Safety Department regarding legislative updates for the school resource officers. I think it was a very productive session and was quite useful. And I just wanted to thank some staff members here who had provided me with some updated information regarding things that directly impact their department. Mr. McGowan was extremely useful and helpful to me in preparing that, as well as Mr. Ayers. And so overall, that session for training for the school resource officers was a productive session that I believe will lead to increased school safety, which is our goal. So that's all I have. Thank you.
Ms. Presbitino?
Thank you.
Okay, thank you.
Yeah, Dr. Gullett.
Oh, Dr. Gullett.
Thank you. Good afternoon again, Madam Vice Chair, members of the board. Just a couple brief updates. Thank you all for your continued support. Excellent questions as always, and feedback. We really appreciate you and your focus on helping us to ensure safe return for our students on Tuesday. We have a terrific team, and I have full confidence in them that we'll continue to monitor the situation and adjust as necessary. I did also want to let you know that tomorrow I do have confirmation that I have the statewide superintendent call with FADS. We anticipate hearing some additional input and insight from our state Department of Health as well as our Department of Education. So as always, I will keep you updated as I learn more information, but that call has been confirmed for tomorrow. And again, thank you to all of you as board members and to our team.
Thank you so much.
Thank you, Ms. Boston Ellis, for filling in the seat. You got out of it, too.
I know, you ran away and didn't come back. Okay.
Thank you.
Thank you so much. Okay, well, with no further business, our meeting is adjourned.